Hey guys, welcome to the 2026 EMS Week Competition. My name is Captain Randy Lee, joined by
Captain Jonathan Rivera.
And we are here at Fort Totten, and we have the competition already underway. We have our competitors out there right now. There is a bunch of scenarios. There are different things they're going to be doing to really test their skills here in EMS stuff. Jonathan and I were former members, actually active members, right?
Still active.
Of the EMS, FDNY EMS competition team, the international team. We went around everywhere, and that's what we did for a really long time. And we've competed in a lot of competitions just like this. And we got to tell you, like, it's a great way to keep your skills up. It's a great way to just test yourself. And that's what these teams are doing right now.
We got to say that it's something that we truly enjoy, and leaving behind a legacy.
Yeah.
As you said, we've already competed in other countries, other states.
Yeah.
And to see that the younger generation to continue this on, it's actually something miraculous to see.
Yeah. And so, as of right now, the competitions are underway. All the teams that are competing across every borough, we have representation here. So, they started doing something called a Cahoots exam. That's not going to be on camera, obviously. They're tucked away somewhere taking a written exam. It's to test their knowledge on protocol, pathophysiology, anatomy physiology, all that stuff, because that's a core thing for us, right? I mean, can you even do this job if you don't know the medicine, right?
No, not at all. I mean,
Yeah.
I think this also helps build confidence with the community and everything like that. They get to see what their street doctors are doing on a day-to-day
100%.
basis.
Yeah, and so we had a bunch of teams already go. We had Division 1, which represents Manhattan, Division 4, which represents Queens, and Division 7, which represents the Bronx. They already went out there, they ran through the course, all that cool stuff. We will definitely be going to video and showing you, actually we have it out right now. So what we have on the screen right now, we have some of the obstacle course, that's what you got on the left side over there. So the point of this is that they're responding to a scene, they're going to be putting on their turnout gear for protection, and they're going to be managing a cardiac arrest. And there's other scenarios out there for, say, CTTF and WMD scenarios, as well as some patient care scenarios, which we'll definitely be taking a look at later. And hopefully throughout this stream, we'll be able to speak with some members of the department who will give some insight on how we do things here.
So one thing to note, if you can see, is that none of the teams are running, and that's something that's very important in our line of work. We don't really run into the emergencies because it kind of like lessens our senses in a sense. So, folks in the community, if you see that we're not running into emergency, it's actually by design.
Yeah, from a safety standpoint, we always have to make sure we're doing things the safest way. In training, when you're doing EMS stuff, one of the first things they teach you is scene safety, and that's paramount here. They actually lose points if they're going to be running around on scene. If they're doing anything unsafe, that's a deduction in points as well. And we found that in a lot of the competitions we do.
Yeah, exactly. I mean, if people are running around and they get the anxiety up, it kind of like messes with your fine motor skills.
Yep.
I don't think you want somebody looking like they had 3 cans of Red Bull starting an IV on you.
Yeah, right?
Just wouldn't be a good thing.
And it's interesting. So almost every EMS agency out there does a certain level of scenario training. But when you're in this kind of environment, and we can attest to this, it's one of those things you feel pressure. It's so hard to artificially create pressure.
Yeah.
But when you're over here doing this stuff, the pressure's on. You have your coworkers watching you, the higher up management's watching you, and you want to do the best to represent your division. And we've competed here as well, and
and they added another layer of stress this year too by making it live.
Yeah, exactly, right? So, now that they're going to be on camera and everything, everyone's super stressed, and they're going to try their best for you guys, of course.
What do we have on camera now?
Looks like a team's getting prepped up. We got ALS over there, Division 8. Oh, Division 8. It looks like they're setting up for a scenario right now. So there's usually about a 2-minute briefing that every team is going to go through. Gets a little rundown of the scenario, roughly about kind of like what our KDT shows. So KDT is something we keep in our ambulances. It gives you a little rundown about what job you're going to. Just like in real life, that's what they're going to get right now, so they can prepare themselves properly. Wear the PPE, all that kind of good stuff, to make sure that they're doing it safe, right? So we're watching Division 8 right now on screen, prepping up, and hopefully they kill it.
So, going back to one of the things you mentioned before, CTTF and WMD. So for the people out, who don't know what those things are,
Sure.
Counterterrorism Task Force and Weapons of Mass Destruction.
Right.
Can you just touch on the Counterterrorism Task Force a little bit?
Sure. So CTTF, the RTF teams, it's in this day and age, you have to be prepared for every kind of situation there is out there, right? And it's a collaboration that we have with NYPD to make sure that during certain situations like an active shooter, we know how to enter those scenes with NYPD, with the force protection, to save as many people as we can. And that's a scenario that they're going to be running through. WMD is a different situation completely. organophosphate's usually the ones that we run with, right? So we have medication for that, and you'll see that displayed today as well. But the training is a lot. We do it a few times a year. We have the day 1, day 2, day 3 stuff, and that's usually done at the Rock. We have the SRG teams come in, and we just learn to move together, learn how to treat together, maximize how many people we can help in that environment, and that's basically it.
Yeah, so we do have specialty units in the department that kind of handle these assignments as well.
100%.
On these things.
Yeah. So currently, right now, what you're seeing on the screen right there is the obstacle course. So the obstacle course is interesting, right? We've gone through obstacle courses in other competitions, and it's always one of those things where you want to run. Right? You have that inkling you want to run, but it's so dangerous. You're moving the stretcher, you're moving patients, and it's just not optimal, right?
I mean, in the military, they always say slow is smooth, smooth is fast.
100%.
That's something that definitely pertains to this obstacle course as well.
Yeah, and it's funny, in some of the competitions we've done where we had the obstacle courses, I've seen teams run, and it really does slow them down. They just get jumbled up, they tangle up in their own feet and everything, and it's a mess for them. So being controlled is much more important than trying to be fast.
Yeah. I think communication plays a huge factor when it comes to these competitions.
Yeah.
Understanding that no one is doing this as a singular competitor.
Right.
You're coming in as a team. So having a game plan before you even come into these things, I think is huge.
Yeah, I mean, I know when you and I competed, that was a very important thing. We had to have the team dynamic, and we were partners on the ambulance as well, so that really helped because we knew how each other worked, and that's a big thing. You would never see an EMS competition where it's only one single rescuer. It just doesn't work, right? You have to have that team dynamic. We're part of this bigger system, so if you don't practice that way, how do you function that way?
Yeah. And I think, the longer you work together, the more jobs you do together, the closer you become with your partners.
100%.
In a lot of ways, your partners are your family.
Yeah. And, looking at the screen, we got some guys going over there for the obstacle course. Yeah, it looks like if we cut over to the next camera, we got a cardiac arrest management going on. There it is.
Cardiac arrest. Let's touch on that. Civilian base. They like to teach compressions only.
Yeah.
That's honestly the most important aspect when it comes to a cardiac arrest. But now with medical professionals and clinicians involved, there's a little bit more to do. Want to touch on that?
Yeah, I mean, think about it. So from a layperson perspective, or any civilian who's watching this, who's not super well trained, the chest compressions are everything, right? A cardiac arrest is basically just saying that you're not moving blood, you're not oxygenating your body. So doing those chest compressions, and there's a threshold, you have to get a certain amount of compressions in before your body can really react to this well. You're going to circulate that blood. Hopefully you have some oxygenated blood over there, because if it's early recognized cardiac arrest and you're working on this stuff, doing those compressions will take whatever oxygen's in that blood, circulate the body, and help perfuse the body, perfuse the brain, keep them going, right? But then when you're a medical provider, like our EMTs and paramedics, you're going to ventilate. You're going to now reoxygenate that blood. And as you continually do that, you move that oxygenated blood around, and then comes in defibrillation if it's applicable. For a VTAC arrest or a VFib arrest, that's great, right? That's the main thing. We can, essentially reset that rhythm.
So for your everyday person or your Good Samaritan walking by, if they were to come up on a situation like this, how is it that you would tell them they should approach something like this?
So the real important thing is that you have to start activating that system, right? Again, we're part of a system, and as a layperson, you are part of that system, right? Watch our teams go right now real quick. We'll go back to this in a second, but so they have to do that low profile. They're moving the patient. I think they're utilizing a reef stretcher, right? And
looks like good teamwork there. Looks like they're communicating, they're carrying together. So
they're moving.
That they're safe as well too.
Mm-hmm. Lifting and carrying, the hallmark of this job.
Yep. Here we go. Now they have another obstacle course we just came up to.
Oh man, now they gotta actually go through this tunnel. They have to go through with the patient now.
This right here is like communication is key on how to navigate through this.
Oh yeah.
Because at the same time, you're still treating a critical patient.
Right. And also during that time, again, you got to make sure those compressions are going. So the faster you can get through there safely, then the faster you can get back on compressions. Minimal delays, right?
What would you say is probably like the max time you should probably be delayed in between compressions?
Historically they've always said 10 seconds, but don't even go by that. Just as fast as you can. Yeah, as least as possible. That's the way to do it, right? Uh-oh, I think our guy got his foot caught. Oh, working around it.
Looks like he decided to go
Over?
backwards to come out.
I guess so. Is he gonna? Are they gonna get tangled up though? Oh, they're working it.
Come out backwards. He's trying to work his boot through. So this right here would kind of simulate any down wires, any cables, anything that would happen in an actual scenario.
Yeah, especially like us as like former rescue medics, that confined space environment collapses. You know, we always train for that kind of thing. And who do we have here? McDermott. McDermott gets through, gets the bag through.
So as you can see, the competitors right now, they have on their PPE, their personal protective equipment on the turnout gear. So essentially, it's puncture proof. It is very thick. It is very heavy. So hydrating in this type of weather is extremely important
Oh,
for
it's
the
huge.
Competitors. And just for the people out right now. Today's a very hot day. Hydrating today is extremely important.
Always important.
So it looks like they got one bag out. One competitor's halfway out.
Are they going to be moving the patient or is it bags? What are we seeing here?
See the one bag. It looks like they're trying to navigate the patient through. Yep, it looks like he's got him navigating the patient through. They're communicating with each other.
Is that their partner?
Yeah,
That's the technique. That's a technique. They're
I
going to pull.
remember you and I did a job and I pulled you through one of those
I
things.
remember that too. That's definitely a technique.
Yeah. No man left behind.
Oh yeah.
I like it. Yep, I see a leg. There we
That's
go.
a leg.
We're working on it.
They're doing it. You gotta imagine that partner has like hands on the patient. They're gonna start pulling them through, probably trying to find the path of least resistance, right?
I mean, imagine the stress that they're having right now, right? Like for us, looking at it on the outside, yeah, it just looks like an open box.
Right.
But for the competitors that are inside that box with the patient, trying to maintain patient care, it's a little darker in there. They have the simulated wires. I mean, like, what exactly do you think is going through their head?
They probably just want to get out of there as soon as possible. It's hard. We've gone through this training. We've gone in there, and sometimes you can zone in, lock in, and just start going, okay, I just need to get out of here. And you want to do it the safest way. And you're still trying to maintain patient care that whole time. Not easy. We're kicking over to the ALS right now. I think they're managing a cardiac rescue as well.
That is Division 2 ALS.
That is Division 2 ALS. I see O'Rourke over there. Okay, so we're back over to the BLS right now. So they got the patient out of the box.
They're doing good compressions. They got fingers interlocked, elbows are stretched out. Looking good.
And as the training goes, you got to push hard, push fast, allow for full chest recoil. Oh, they got the Lucas.
Oh, so right now they're putting on the Lucas device, an automated compression device that the department now utilizes when transporting patients that are in cardiac arrest.
Right.
It helps assist with compression so that there's no delay. They can just keep carrying along, transporting without any delay in compression.
Yeah. 100%. And so you're going to notice that they don't turn it on because it's not rated for a mannequin. You don't want to destroy the mannequin. So they're placing it, they're verbalizing their way of how they would turn it on and such. But as you can see, they're starting to the transport procedures. Yep, picked up that reeve.
This also allows for the members to have extra hands, right? Because now they don't have to tie someone up in the compression. They can now focus on other things, right? For our medics, you have your IV medications, you have your airway, right?
Yeah.
Intubate, put a breathing tube to help someone.
Yeah. And, it's interesting. So notice that their stretcher's down, right? These little mechanic things make a huge difference when you're on scene. And, can you imagine, like, you bring a patient out, your stretcher's raised all the way up. Are you going to take the time to lower it down the safe way, right, to get the patient on? Or are you going to try to muscle it and put it on a raised stretcher? That second option is so dangerous. It's top heavy. You can knock the whole thing over. It's a detriment to the patient and the provider. So smart mechanics is the way to go, and that's the core.
So you could say it's good to have an anticipator in your group.
Yeah, and that was something that you and I did when we were competing. It was always important to have an anticipator, someone who kind of had the global picture, the macro, right?
Someone that could step back and kind of see the whole picture.
Yeah, and that's super hard because as EMS providers, you're so focused on the patient. There's so many times when you can literally zone out the whole world. Sometimes that's okay, but sometimes, it's so dangerous for the scene. But that's why we have scenarios like this, for them to train in that way.
Yeah, we could say, like, real world scenario, if something like this is where your officers kind of like play a role, right?
Oh, yeah.
They don't necessarily, inundate themselves, get themselves involved with the patient care per se, but they're the ones that kind of take that step back.
Yeah,
and look at the global picture and try to make things a little easier for the crews that are working.
100%. And we're kicking over to the ALS right now. It looks like they have the patient intubated.
Oh, good.
Yeah.
And actually, it looked like they took them less than a minute to do that, which is impressive.
They're doing quick, yeah. So for those who are watching, intubation is when you take an endotracheal tube and you slide it through the trachea to give direct air to the lungs, essentially, right? It's one of the more advanced procedures that paramedics do here in New York. and everywhere in the world, actually. I guess every paramedic.
Yeah, I mean, this is something when you hear people say, we're bringing the ER to you, we're bringing the emergency room to you. These are all things that would be done in the emergency room.
Yeah.
We do this right on the floor of your living room if need be.
Yeah, 100%. I mean, that's the point of us, right? Like, we will bring treatment to wherever you are and then bring you to definitive care. You know, countless times, you and I have done this, where we've brought a patient to the hospital and they put their hands up and they're just like, oh, they did it all. Yeah. And that's a hallmark of, like, really, really good paramedicine, to be able to execute everything that ER would have done on scene, if it's applicable. Because there are times when it's not the smartest idea to stay on scene and do all the medicine, because you need that definitive care. There's that second step. Again, we're part of a system.
Well, you always hear this, you hear the phrase "time is muscle." You know,
time is muscle, yeah.
Play a role.
Is that the ALS team going through?
Yes.
Yeah.
Looks like they're finally going.
They got through pretty quick.
And yeah, that first team member went through there pretty quickly. It looks like he definitely did well in the jungle gyms.
Yeah. I wonder if they're going to do the same technique about pulling the second member through. Oh, it doesn't look like it. Oh, maybe.
Well, we see one member that's standing up upright on the other side of the box. Looks like he's probably guiding the patient through.
Mm-hmm. And you can see the EMS instructors all around, the evaluators, the scoring judges. You know, they're taking a quick look to make sure that they're also doing it safely. So, again, safety is of the utmost concern for something like this. All right.
Yeah, again, we go back to the smooth style.
Oh, yeah.
It seems like they have a nice system going on. From here, it looks like they're communicating very well.
It looks like they're getting that patient out. They're making moves, for sure. Because the worst thing is, like, can you imagine you're doing this scenario and you get that one tangle and you're so close to getting that patient out. That one tangle is going to mess you up, and you know that's where you really still have to maintain your calm.
Does that increase your anxiety?
The anxiety is like next level, right?
All of a sudden,
oh, they got him out. There you go.
Yep, they got it.
Yep, and maintaining CPR right away. That's great. So as you can see, that little orange/yellow board, that's going to be the part of the Lucas device. So, patient's on the stretcher.
Is the patient on a reeve sleeve? Is what it appears to be.
Oh, reeve sleeve, yeah.
Carrying device that we one of the many carrying devices that we utilize in the fire department.
Compressions are going, and it looks like they're getting ready to put on that Lucas device.
Yeah, because that's just going to free up some of the hands. You know, it's just going to make things so much easier. It's just better for the patient, right? Because as we discussed earlier, there's just minimal interruptions in the compressions, which is the most vital part.
Right. And again, we were talking about this a little bit earlier, where there is a threshold. So you have to get a certain amount of compressions in before that blood is now actually moving the right way. Because I think maybe like the first 10 seconds, you're kind of like ramping up an engine, right? So it's not quite moving just yet. And that's why, like, when you have a delay in CPR, when it slows down, then that threshold goes back down. You really got to start ramping it back up again. Yeah,
exactly. But it's also important that you rotate, right? We've noticed, and you know, they've studied it, that 2 minutes usually seems to be the hallmark or the benchmark to start switching out members, because fatigue does set in.
Yeah.
You know, you can be the most fit person in the gym, you can be running around, you can, you know, climb stairs, but you know, 2 minutes straight of CPR in your gear, in the heat, you know, it drains anybody.
Yeah, and that's one of those things that you have to kind of take your ego out sometimes, because, you know, you're on scene, you're like, I can keep going. It's not about you. It's about the patient's best outcome, and that's when you need to switch. Even if you feel like you're ready and you can keep going, there's been studies proven that the compression quality does decline.
Yes,
you know?
Absolutely. And this is, you know, like you mentioned it a couple times already, the team dynamic, right? This is also where we would work with the firefighters as well, who would come on scene of a cardiac arrest and assist us with compressions and transport of the patient, packaging, carrying, things like that. This is where we can definitely, you know, officers on scene can rotate the members of who's doing compressions to ensure that we have quality compressions throughout the cardiac arrest.
Okay, and we can see the ALS team right now as they're moving through. As they're moving through the course right now, they got that low angle.
Yeah, so it looks like they're maneuvering through the obstacle course. They decided to keep the stretcher in a low position. It looks as if it made it easier for them when it came to the intubation. That's why they kept it that way. So not everything is like the movie you depict.
Right. And, you know, that's a great thing about electric stretchers.
You can raise it and lower it as much as you like.
Yeah.
As you like. But continuum of care, one member has already jumped into the ambulance to continue the care, take over the ventilation.
And here we go.
Look how many people have come out to support their teams.
Yeah.
Right now.
So they're loading up their patient now.
They've loaded into the ambulance. They're going to continue care. The care does not stop once you get into the ambulance.
Yeah.
They're continuing their compressions. They're getting their Lucas device going. And probably right now, I'm going to assume that they're going to start doing their medications.
Yeah, and this kind of keys into the slogan of this year's EMS Week, where it's improving outcomes together, right? So between us, police, fire, the hospital systems, that whole system works together in tandem to improve patient outcomes. That's why we're here, right?
Continuity of care.
Continuity of care is super important, right? And that's why every medical provider is a patient advocate.
Yes.
That's the whole point of us. We're there to make sure that everyone gets the best outcome possible, right? So as the teams are resetting right now, we're just going to reiterate, welcome to the 2026 EMS Week Competition here at Fort Totten. My name is Captain Randy Lee, joined by
Captain Jonathan Rivera.
And we're going to give you the play-by-play. We're live streaming all day. We're going to be talking about the competition. We're going to go through the teams. We're going to talk about everything that's going on. And hopefully we're going to have a couple of guests who are going to speak about, from their perspective, the importance of EMS, the importance of EMS Week, and where we're going to go from here. So as you can see, the teams are just basically resetting right now, all the stations. You see some of the members in the gray. Those are the EMS probies currently. Basically, the probies are our academy students, and they are here basically to help us out while they're in the learning process. We really do appreciate their help. They're really helpful in that way. And hopefully, where we should be getting a guest in at this moment, I believe. Fantastic. All right, as we settle in right now, bringing on to the show, we have Executive Director of the FDNY Foundation, Miss Jean O'Shea.
Hello.
Welcome to the show.
Thanks so much for having me.
How are we doing?
Oh, I'm wonderful. This is so exciting.
It's fantastic, and
so exciting.
We really want to thank you for the support from the FDNY Foundation for all the events that you hold for us. And we were at I was at the Search and Field Medical Field Symposium. Dr. Ives is going to be upset I said that wrong. But the support over there, the support over here has been insurmountable, just the amount of stuff you guys do for us. And we really want to thank you for that.
Well, thank you. I'm here on behalf of my board. I have a wonderful board of directors and all the people who support us. Foundations, corporations, and individuals that support the FDNY Foundation because of our remarkable FDNY members. I'm so excited to be here today with our EMTs for EMS Week. These are truly an incredible group of people. And I'm just very humbled by the training, by what they do, and we can't thank them enough.
And we want to thank you, of course. But do you have what's the next on the foundation's list? What new events are we going to have coming up down the pipeline in a couple of weeks? Or
Yeah, well, we have a very busy week, EMS Week. We have the Second Chance Brunch coming up this week. We're going to have our summer block parties throughout the city where you can learn and hear about the great work that we do with the FDNY CPR unit and the Stop the Bleed program. So we're very busy, and then of course the 25th anniversary of 9/11. We have a lot of ceremonies around that we're going to support. And then we have the FDNY Foundation dinner we do every year.
Oh, yeah.
That's where we bring the corporate people, the business people,
Yeah.
the foundations, the individuals to really support the remarkable work of the
And how important is it that these outside companies really reinvest in the FDNY and support us?
I mean, we're the greatest city in the world, the
Yeah.
biggest city in the world, so densely populated, high rises, subways, everything. We've got to continue to fund training, equipment, and any needs, and health and wellness is a big thing we're trying to support as well of our members. I mean, you're extraordinary. You respond to, millions of calls a year, fire, EMS. It's just amazing, and I don't think we thank you enough, and we let people know that we are such an integral part of the greatest city in the world, and we need the support of the outsiders.
So what would you say to the public that's watching in terms of supporting an organization like the FDNY? Like, what are we telling these guys?
I'm telling them, number one, you're supporting the greatest group of men and women in the world, our EMTs, paramedics, and firefighters. And we need your support so they can continue to save lives and protect property. Simple as that.
Simple as that, right, guys? So, just so we know, because you did mention the Second Chance Brunch, and that's a super cool event, right? So for our viewers who don't know, Second Chance Brunch, Second Chance Celebration is an event where we bring firefighters and EMS personnel to basically meet with people they've saved. And I've been involved with it for a number of years, and it's such an amazing event. The venues are gorgeous, and the more important thing is that as an EMS provider, I don't always get to meet the patients I help after, right? I drop them off at the hospital. I hope they get better, but I don't always get to interact with them after. But to have something like the Second Chance Celebration where we get to do that is remarkable.
So amazing,
Yeah.
so humbling, and to your point, you men and women save lives every single day, and you leave them at the hospital or whatever, and this is an opportunity to bring them together, and it's just so humbling and so grateful on everybody's part, and just these are the great stories that we need to tell out there in the big world where there's a lot of negativity, and our FDNY members are absolutely amazing. And I thank you, and I congratulate everybody for EMS Week and the divisions and the stations, and the FDNY is here to support you, and thank you.
Thank you. We appreciate it so much. Thanks for joining us on this podcast, and we will catch you on the next event, right?
Absolutely.
Fantastic.
Take
All
care.
right. Take care.
Kids, I gotta run. Thanks, Scott.
And that was the Executive Director, Gene O'Shea of the FDNY Foundation. Super big supporter of all things FDNY. They're a major sponsor for this FDNY event here, the EMS Week Competition, as well as some of the stuff that we're doing around the station. So from a station standpoint, it's important for us. Welcome back, by the way. It's important that we get back to our membership as well. So as captains, we run stations, and a lot of times during EMS Week, we give our own gifts to our membership, and we do events for our own membership to show our support for them and try to increase morale, and just show that we do the job too, and we're super happy that everyone's doing it with us.
I mean, I think we understand, we both have our own commands or anything like. Without the members, I mean, none of this is possible, right? So the EMTs and paramedics, they are the backbone of this EMS department.
Yeah.
They need to be acknowledged for that as well too.
And you guys can see we had a couple of the teams just walk by behind the camera. They're just waving at us because it's a giant family of EMS people running around here today. Fantastic.
But, you were talking to Gene for a second there about the Second Chance Brunch. This is something that you and I both had the opportunity of being involved with. We got to say that this is something that is amazing for the competitors, but it's also amazing for the families, right? We gave them a second chance with their loved ones. We gave them extra holidays with them, and that's something that we work for.
Yeah, I mean, it's remarkable to see when patient, provider, they meet, and sometimes it's for the first time since that event, and that's very emotional for a lot of us, and it's hard, right? Like I said, it doesn't always happen, right? We don't always get the chance to re-interact with our patients, and sometimes we get lucky and we do, but
I mean, we clearly have a lot of not so great outcomes on this job. I mean, it kind of comes with the work that we do.
Sure.
But when we can have those, those deliveries that we have, bring a new life into this world, or again, the Second Chance Brunch, right? We're giving families extra holidays with their loved ones, extra days with their loved ones, extra memories, right? I can say that for myself. I still have one of the gentlemen that I say that still texts me on the holidays. Says thank you every holiday.
Yeah.
Appreciate you. And it's it's something amazing. But going back to the competition now, so we have the next group of teams right now currently doing the compressions, cardiac arrest scenario.
Yeah, I'm unsure which team this is actually, but as you can tell, they're doing CPR right now, doing the whole thing. Yeah, chest compression's underway at this point.
Yep, this is going to be a BLS team that's going right now.
Yep.
So BLS, CPR, probably the most important aspect of compressions, in my opinion.
Yeah, for sure. So for those who don't know, during a scenario like this in real life, the FDNY deploys CFR companies, which are firefighters, along with ALS and BLS, what you're seeing here right now. So
Police as well. We've had them on scene.
We've had police on scene as well, correct.
I mean,
yeah.
Sometimes if it's just you and your partner, you got to utilize what you have.
Oh, yeah, 100%. And, it's funny, in competition world, we've utilized anyone at that point. And, that's where that's kind of where that book knowledge stuff kind of comes into play, right? Where you have to be able to teach somebody on the fly of how to do compressions well. Like, you know, we were talking about, I think you alluded to it before when you were watching someone else do compressions. Your shoulders have to be over the sternum center line of the chest, right? You want your arms straight, all that stuff. As you can see right here.
I think also one of the important...
Is that an officer?
That is an officer. They have an officer on there too. Look at him go. I gotta say that one of the things that I believe should really overlook is the mental aspect of this, right?
Yeah.
Like, you know, just treatment, yes, medication, physical, everything, but we also have to remember the mental aspect too.
Yeah. I mean, it's definitely a stressful job at times, right? It's super rewarding in other times, and there is a large amount of camaraderie between your partner, your station, you know, your division in whatever capacity, and you know, all those things coupled together what make this job great, right?
I know for us in our competition bags, we always carried like a bear, an ambulance, or something, and that was like our emotional therapy, like our emotional support device that we would use, you know.
100%.
This aspect, you know, because we do treat pediatrics as well. Unfortunately, we have a lot of children that we have to treat, so having something to with them, I think a lot of it is anxiety based, right?
It can be, yeah.
Strangers coming into your home, you have radios going, you have all these bags, all this equipment, you have things that kids just may not necessarily be aware of.
Yeah.
And, you know, just coming down to their level, just, you know, sitting down, talking slowly, talking lowly like I'm doing now, and just kind of like easing the scene off, getting that anxiety.
Yeah, and from a textbook perspective, that's called psychological first aid, right? And that's important because while you could say we have the skills to do what we need to do, there's a human factor, and you know that's good bedside manner essentially, and you know you have to have that, and just you know that's all the hallmark between the greatest of great EMS people versus the ones who are quite good.
Oh yeah, absolutely.
You know.
I mean, how many people?
Oh wait, hold on, we got to see this information going down here. Playing that bulb, side lights out. That was quick. Looks like Lieutenant's got him covered on that.
Anticipating, right?
Yep.
Looks like they have the endotracheal tube securement device that he's wrapping around the neck now as we speak. Okay, what are you up to?
Yeah, and it's really important to make sure that's locked in well because, you know, movement of the patient, especially in these kind of situations, is something you got to manage, right? And you lose that tube, you got to start, you know, all over again. Or you can switch to a BVM, but obviously intubation is a much more secured airway. It is definitive. Yeah. Yeah. And I know, like, every EMS provider has like their own techniques for little things like that. I know that before we had securement like locked in on a tube. I think one of our other partners, he had this habit of kind of putting his closed fist on top, and to make sure that it was pressed against, not hard, but pressed against the patient's face so it wouldn't jiggle back and forth. Yeah. Right. It is a finesse thing for sure.
Strongman competition, which is on the other side.
That's over there. Yeah.
This is more of a finesse.
Yes. Yeah.
Like you're toasting your compadre.
Yeah, that's the way they always teach it, right? You have to toast to like the top left corner of the room or something like that. Yeah. And also, for the viewers, we are also EMS instructors, so hopefully we still remember what we're talking about. It's been a long time since we taught in front of a class. But to go back over to the course, actually, no, we'll go back to us. Why not?
We look good today.
We look good. It's fine. It's totally fine. Yeah. So
this competition's been going on for over 20 years now, right? So
yes.
We're back to the teams. So as of right now, this is ALS?
No, this is ALS. I can see the cardiac monitor.
Oh, good eyes.
Yep.
So what are they trying to do with the monitor?
So let's go through that. Everyone colloquially knows like the defibrillator, the AED, right? For ALS members, they carry a...
Is that what you see on the TV shows?
Yeah, right? So back in the day, you had the paddles, put it on the chest, 15 pounds of pressure, the whole nine. But no, they switched over to the cardiac monitors now, which have the ability to read EKGs. Well, they present EKGs for us to read. You can do capnography, blood pressures, all these other things. And ultimately, they have the ability to defibrillate a patient as well.
Awesome. And in defibrillating the patient, what is the outcome? What is it that we're doing? What is defibrillating? If you had to explain it to your civilians.
Okay, so defibrillation. So there are certain cardiac dysrhythmias that are chaotic, right? So you have VTAC, VFib, and the only way you can kind of stop that from happening is using an electrical shock, right? So that's defibrillation. Basically, we'll cause the heart to stop for a second. The heart will kick in with its automaticity, and then it should go back to normal. Now, does it happen all the time? No, but that's why we're there, because we have ways of managing all those different kinds of scenarios.
You're talking about those squiggly lines?
The squiggly lines of EKGs or ECGs, depending on where you live in the world, they have different names. So yeah, so you'll see those on TV all the time, those little squiggly lines and whatnot. And those are cardiac rhythms that we can view from, right? We could see them, it reads a certain angle of the heart, the electrical activity of the heart, and that's how we interpret what's happening with the heart.
So again, something else that, again, we're bringing ER to you, essentially.
Yes.
We're getting the first steps done so that we can get you quickly to the hospital and continue that continuity of care.
Right. And the, you know, the technology in that space has changed dramatically. If you look at the original EKG machines they used to take around, they're huge. They look like suitcases. Yeah. And they only did like one lead. I think it was like essentially lead 2.
Right.
But now, you know, with the newer cardiac monitors, especially the new ones that we have the new life packs. You know, get those 15 leads in, you could transmit it, and that's a big thing. We transmit it to our telemetry, our online medical control, for them to interpret it with us, right? Again, it's a big system. It's not just us. We have our doctors who are always at the ready to help us.
Right.
And we send it to them, and we go, hey, listen, look at this EKG, look at these squiggly lines. We think that it's this kind of problem. Doctor confirms, and now we have the ability to take them to the most appropriate hospital, because not every hospital is the same, right? You have
different
trauma
capabilities,
centers,
right?
Cardiac centers, replantation centers,
Burn centers,
right? And
which all the fires lately has been very important.
yes, and you know, that's the main thing. So while we can treat on scene, again, the definitive care of getting them to the hospital, the correct hospital, is super, super important. So you know, that's the recognition part that our medics and EMTs do.
So talking more a little bit on the equipment, right? Because we're showing the Lucas device right now again, which is something that we said is assistance in compressions, right? We also have the video laryngoscopes that our medics utilize in the field nowadays, right? Just a camera.
You and I didn't have those.
No, we did not. We had to learn the other way. We
had
eventually
them
got
for
them.
rescue.
Yeah.
For rescue, but not for regular assignments, right?
But we could talk on how like it has huge pros for the patient, right?
Oh yeah.
So statistically, it has more first-time passes, right? First-time successions, which is great for the patients and great for the members. You may not necessarily see it out today in the field because of the sun, it kind of glare on the screen and everything like that. Yeah. But you know, for the public to know, this is something that our medics carry on the ambulance with them.
Yeah, so let's go into that just a little bit. So intubation, again, the way, I guess generally you would intubate, you use something called a glide scope. You have a blade on the end of it. The whole point is to basically lift the airway up to a certain degree so you can basically stick an endotracheal tube through the trachea to get a definitive airway, right? Put it simply, you take some kind of blade, lift the airway so you can stick a straw through that goes straight to the lungs, right? And if you're being super technical, you have like Mellon potty scores and all these kind of things that give you a level of how difficult it will be to intubate somebody. But a lot of that stuff has to do with the anatomy of the airway, how their jaw is, and everyone's face is different, right?
Right.
But using a glide scope, you get this video view of the glottic opening, the airway, and it allows you to have better accuracy for you to intubate to make sure you get that on the first shot. Because it's important. Because every time you're not intubating, you're not ventilating the patient, they're not getting air.
When we look over at the team right now, you can see how they're utilizing the electric stretcher.
Yep.
They had just brought it all the way down so they can get through a low-profile situation. And now they're raising it back up to make it easier on themselves.
Yeah, it looks like they're at the final part of their obstacle course here. They're going to be...
loading the patient towards the ambulance, it looks like, at this time.
Oh, that's right. So I don't know if they had finished the course in time. So the way it works for this specific competition is that they're in 20-minute blocks. So everything is locked down to a time frame. Speed is important, accuracy important, safety is important. And once time runs out, no matter where they are on the course or wherever they are in scenario, they have to stop at that point. They will get points for getting up to whatever they're up to at the time, right?
Okay.
But it looks like they're on reset right now. So for those who don't know, we have a we have a couple people out there helping us out. As you can see, some of the footage is coming from different angles and whatnot. So
huge shout out and credit to all the helpers today.
Yeah.
The probies and all the other ones that came in today to help make this happen. Yes. Yeah, I mean, when
you're live,
we know too many people. I think that's what it is.
I think that's what it is.
But yeah, I mean, without all the helpers, without all the staff, the probies, interns, newer folks, foundations. I mean, none of this is possible.
Yeah. And you can take a look right behind us right now. We have so many people here. This is an event. It's okay. So we got family and everything, but we're gonna kick it over to Hemraj Prasad, who is our field guy, who has the camera out there. He's hanging out with the teams that just competed. We're going to kick it over to him in just a minute.
Hey guys, what's up? I'm live now with... Hey guys, so I am live with Division 8 BLS and ALS that just finished an entire cycle at the competition. So guys, how was it? What was happening?
It's pretty cool. Very challenging. But as we expected, anything we do in this job, it is challenging. So very well put together.
Nice.
Enjoyed it.
And how was that scenario? What did you have to do, guys?
Yeah, to be honest, they put the pressure on us, but it's an everyday thing for us. Pressure is every day. Every day we got pressure, so we did pretty good.
And can you guys describe what exactly was the call? What was the scenario?
It was a CTTF scenario. It was basically a mass shooting. We had to go in there, triage, treat, and get everybody that's viable out.
Got you. And I'm going to ask one of the paramedics that we have here, Paramedic Rubiello. What did you guys have?
We had a WMD incident where we actually had the same thing as them. We had to treat multiple patients, treat accordingly, and get moving pretty much. That's the biggest thing, especially with hazardous material, essentially.
Very nice. And what's the best part about being here today, Mustafa?
The best part is we're up against the best, and you really got to be on point. Competition's really stiff out here today, and it's more of the same of what we do every day, day in and day out in the streets.
Very nice. Sounds like we have a lot of Brooklyn pride, that Brooklyn North pride, right, boys? Yeah? All right, well, I wish you guys the best. All right, Randy, I'm going to send it back to you.
All right, we're back. So that was Division 8. And just a little shout out, we got a little message over from Brett Fields. He's the captain of EMS Station 57, wishing his BLS team all the best of luck, hoping for a repeat of a win from last year, carrying on that legacy, so that'd be great to see. So before we get back into it, let's just give a couple of shout outs to all the players we have out here in the world. So we have the ceremonial unit who's running sound, audio. Mario Tompkins is out there hyping up everybody.
FDNY Foundation.
FDNY Foundation, of course, Gino Shea, super supporter. We got
Bureau of Training is out here, right? They have all the instructor staff and everything. They're all out here. You have EVOC staff that's out here.
Yep.
You have the counterterrorism staff that's out here.
Yep.
You probably have staff from the SOC battalion as well too that are out here
For
assisting.
Sure. I would say so, yeah. And then also we got all the division staffs out here. So divisions 1 through 9, all of the BLS coordinators, ALS coordinators, they're all here.
And communications, don't forget communications, buddy.
We can't forget communications, but of course communications here. We could kind of see them. They're super far back there because they have spirit tables, because they have that going on right now too. It's a way for every division and dispatch to show off a little bit of character, a little bit of style, and just spirit table it, right?
Mm-hmm.
Hopefully we'll get a chance to kind of bring the camera over there so you can check out some of those cool spirit tables. I think, again, the theme this year is improving outcomes together, so they're using that as their motivation to how to decorate their table. So hopefully later on we'll get to take a look at those things and
see how everybody works as a team, right? So we're going to touch on something that is not really spoken about enough, and I think it's because you and I have not really been in that world for long. I'm recently a part of communications now, so now I can kind of see the other side of the job, right?
Yeah.
So when the calls come in, right, people don't understand those phone calls actually are patient care themselves as well too. So the calls come in, you're hearing the person in their worst, and then we're moving on. We get a dispatch out into the members into the field.
So let's take it from there actually. But we'll be right back for a second. We're going to bring in Kathleen Newth. We're going to have a nice long conversation with her. So just make sure you talk without leaning forward.
Nope, right, yeah. I look super good too, right? Oh.
Assistant Chief New, how are you?
Good. How are you guys today?
Doing good. How are we liking this so far?
Oh my gosh, it is amazing. We redesigned the whole competition this year, so I'm very excited to see how the changes are being implemented.
So, you can just tell us and all the internet, are you rooting for any specific team?
I'm not rooting for any specific team, to be honest. My job is citywide, so like I hope they all do good and really just have a good time.
Okay. So, from a leadership perspective, what does EMS Week mean for you?
EMS Week is a really important time of the year because it helps us remind all of our first responders, our EMTs and paramedics, just how important they are, how much they make a difference both here in New York City, but you know, to the FDNY, to their families, to the community. I think it is important nationally that we take time to recognize these types of workers and what they do, and we take the time to learn about, you know, they're amazing people and they're doing amazing things. The skill level, the technology, the equipment is so much more advanced than what you might think of if you were to think what an ambulance looked like even 25 years ago. And a week like EMS Week gives us that chance to see them and see things like this where they get to demonstrate all their skills.
Yeah, for sure. And yeah, they're using all their tools today, right?
Yeah. Oh my gosh. Yeah. They all have to come with their full set of gear that they would have in the ambulance with them. And I believe that the instructors here, they did an excellent job making sure that all of their stuff, even stuff they don't use every day, got to be taken out and showcased.
Yeah, for sure. And when does planning for something like this start?
We will probably begin planning right after this ends. So we'll take 1 or 2 weeks off, but after that we are going to do a debrief. We go through like what went well, what opportunities we have to improve. And then, you know, starting in the fall, we'll do like a big push to start getting all of our ideas in place. There's a lot of other components to EMS Week besides what we see here. So some of those have some logistical needs that need long-term ordering and planning, and that'll all begin in the fall into the new year.
There's a lot of events that will be happening at the station level, some for the membership and a little more forward-facing. Are you going to be attending any of those events?
I hope so. I did see the schedule come out, and there is a lot of cook-offs and barbecues, and some of our members are excellent chefs, so I have to make sure that I go visit the ones where they are doing you know, more than just the standard hot dogs and burgers, although I do love a good hot dog. So.
That's true.
And then also later this week on Wednesday, we're going to have the Second Chance Brunch, which I'm very, very excited to attend because this is where our survivors from cardiac arrest get to meet the rescuers. That is the firefighters, EMTs, paramedics, and dispatchers. So their whole kind of chain of survival that allowed them to be resuscitated in the field and like live their best life now, they get to all reunite, and it's very special.
Because we're improving outcomes together?
We are improving outcomes together, that is correct.
That's exactly it. So next year, do you think you might compete?
I don't know that I will compete.
What if Jonathan and I say we'll team up with you?
All right, if I have the ringers here, Jonathan and Randy, then we're going to have to start practicing early because, you know, we have to be number one.
Yes, that would be terrible if we lost. Fantastic. So, story time, because we're EMS people and we love telling stories. It was EMS Week, large number of years ago. I was at Station 55, and it was a chili cook-off, right? And I brought in my chili. I worked the overnight. I brought it in, put it in the kitchen. Everything was all good. I came back in the morning at the end of my shift. Everyone on the overnight shift ate the chili.
Oh, I believe that.
So I never had a chance to compete. I was very upset. And they said I would have won. So consolation prize, I guess.
All right, well, I'm going to give you a little pro tip. You got to team up with Dr. Isaacs because he's trying to revive the chili cook-off in Division 1 and 6.
Oh, okay.
We did have one 2 years ago. But I know that he's looking to do it yearly. So if you want to enter in some chili,
that sounds like a plan. Maybe I will. All right.
But I do believe that happens on Tour 1 because they probably thought you were giving them a present.
I did. You know, that's a thing. And I mean, it was food.
So for those out there in the wider world, Tour 1 is our overnight shift. They're our midnight warriors, and they often get overlooked, even though they have a special place in my heart because that's where I started. And so I know that they really just thought Randy was giving them a little treat.
It's very possible. And and I was an overnight person also. It's a different beast, and it's a different culture of people sometimes. And I gotta say, I always liked it more. I thought it was a lot more fun being on the overnights.
I did like it. The
Yeah.
city is a different, it's quiet, but
It is a different
still
view of the city.
exciting, and
Yeah.
you get to see Times Square with no crowd, so it's all yours.
That's always exciting.
Yeah.
It's really cool.
The Christmas tree, that's always a good one when you're the only one there.
Yes. Yeah, I remember doing that as well. And we gotta go. We gotta do like the tree lighting or something like that. We're gonna do that special event again because that's one of the super fun ones because you don't get to always see that stuff. So, yeah, I'm gonna have to check into those things too. So, it looks like the next group of teams are underway. What do we have right over here? Right behind it, we have a BLS team going. So when you look at like the way the obstacle course is set up, you know, we have like this low angle stuff, we have a little bit of the tunnel. You know, how does that translate to how we're doing the stuff in the field?
So, I mean, not all of this translates directly in the field. There will be probably a select time in your career where you might have that kind of rugged climbing through stuff. But mostly, this event is also supposed to be fun for us to watch. And adding that little stress or that little struggle. So even though, like, you may not actually having to be going to a confined space very often in your career, you do have stress in your career all the time. And so this is one of those ways that we recreated that stress so that it was a little more exciting for the competitors and for us to watch.
But that communication factor is always key. And granted, you're not going to go through a, like, 4x4 box often, right? But that communication of how to navigate with your team is probably going to be super paramount in whatever capacity you're doing.
Oh yeah, that, I mean, and we see that our most successful teams in this obstacle course are the ones that have the best communication, because when they're trying to navigate these like unique situations and move their equipment and their patient safely, they have to be constant contact.
Yeah, for sure. I'm just seeing what we got on the screen right now. Oh, okay. So for a brief moment on the screen, we had the I think that was WMD. So again, we have multiple scenarios going on right now. We have a WMD, an RTF, 2 patient care scenarios, and the 2 obstacle courses. We've been focusing a little bit on the obstacle course at the given moment just because it's right behind us. But with the RTF scenario that we're going to see a little bit later, a question kind of came up in terms of like how relevant is that kind of stuff happening for us now?
I mean, I think it's very relevant. We had a pretty high-profile shooting in Midtown last year, and unfortunately, nationally, we have seen quite a bit of gun violence and those kind of bad actors out there. And it's one of those skills that is a low frequency but extraordinarily high risk, and we don't get to practice it as often as maybe we should. And we really believe that being able to showcase that equipment and keeping that kind of mindset of situational awareness, and that we have all this cool safety gear and things that are designed to help us at this competition is one of those ways that we could be prepared for when it happens in real life.
Is that kind of like a remnant of your time at the EMS Academy, doing the reps to make sure that you can do the skills well?
That is very, very true.
Yeah.
That, you know, like, or anybody who's been an athlete or anything, that you're going to play like you practice. So if you are not practicing those skills, when game time comes up, you're just not going to have them. So we try to find fun or unique ways to incorporate learning anywhere that we can, and one of those is the competition. People are going to watch it, people are going to talk about it, and just keeping that mindset that we have all of this amazing equipment. Go touch it more than you do.
Yeah.
Go see it, drill with it, talk to the bosses about it. Just keep practicing, keep getting better.
Yeah, for sure. And gotta love live streams. Yeah, it's one of the funny things. I did an RTF training recently, and it was just having the vest on, having to grab the equipment. It feels funny when you don't have the muscle memory as dialed in as you wish you did. And that's why we do the training. That's why we do the reps, like you said. And it's important to do those kind of things. And
yeah, that's a big part of it, because conceptually you think, oh, I can translate all the skills in my slide deck to this scenario, but when you change any one aspect, and maybe that is just putting the vest on or putting the helmet on, you're doing something, even if it's something that you do every day, you're doing it in a unique way, and that sometimes can give us a little extra stress. It can throw off our battle rhythm, and practicing it and really familiarizing ourselves with all our equipment is pretty key.
yeah, it's funny. Even little things can really throw you off. Like if you're wearing a radio strap and you have it normally on your right side versus your left side, and you switch it around, that muscle memory and just messes you up ever so slightly where it can frazzle you for the rest of the day, honestly. So, yeah, got to get those reps in, got to get your training in, and that's for anybody out there who's listening or watching from an EMS perspective or training perspective for anything you're doing. So, on the screen right now, we got another crew doing CPR. It looks like, I believe that's an ALS crew. So for those who are watching, we currently have a CPR being administered on screen right over there. So the point is for the medics, they're going to give their first line medication, which means they're going to have to get vascular access. I mean, they have to get an IV in or an IO, and then also provide some definitive airway things, which is going to be an intubation at that point. So we're just taking a quick look and watching these guys go.
And again, just like anything, we don't necessarily wear all this equipment on every run, but for today's purpose, we wanted to showcase all of our stuff. And just that if you're in New York City and you're at a scene of a big accident and you're looking for medical help, you're going to scan for tan. I know.
Scan for tan, yeah.
I'm aging myself a little bit with that catchphrase. But, all of our EMTs and paramedics will have that tan PPE on with the yellow striping and orange helmets. And if you need help in New York City, you can look for one of them.
And it's important to have those distinctions because when you're on a big scene, when a lot of stuff is happening, especially like you have a tourist or something coming into New York, those identifying markers are really important. We do parades. We do, oh my God, like every event in the city we're involved in. And sometimes we're in our PPE, sometimes we're not, depends on the situation. And, if you need something, you got to go to the right people. You can't necessarily come to EMS for police matters. You can't go to police matters, go to the police for EMS things. So it's important to know how to identify our folks out there. So look for that tan, look for that orange helmet, or you can look for the black turnout gear, which usually is a firefighter, and cops look like cops.
But I mean, like Mr. Rogers said, look for those helpers. We're all out there. We're one team to keep you safe, to keep New Yorkers safe.
All right. So, want to thank Chief Newth for visiting us today. I'm sure you have a lot of work to do out there.
I'm sorry I look so frazzled. I was not, screen ready.
I didn't do my hair either, so, I mean, it's fine. So we're going to cut over to the competition over here for a minute, and we're going to let Chief Newth kind of skedaddle her way back to her work. So thank you for joining us again.
Yeah, no problem. You guys have a good day.
All right, take care. Alrighty, back on screen we got the CPR going on from, I believe, an ALS unit. Yep. It's really hard to see from this far away.
All right, I'm back, buddy.
Welcome back, bud.
So, one thing that I think that we failed to talk about, right, that I think we should probably bring up, today is the beginning of EMS Week. So,
yes.
So what is EMS Week? Talking to the civilians, talking to your everyday personnel. How would we explain EMS Week?
I mean, it's just like every other one of those kind of holidays. You had, I think it was National Nursing Week or something?
Yes, we had Nurses Day and everything that passed by already, correct?
So, EMS Week is
Shout out to the nurses. Go ahead.
Shout out to the nurses, of course. Thank you. A lot of the stuff that we do for this week is because of EMS Week, right? It's the week that's designated for EMS personnel to really celebrate ourselves, I guess. And, it's super exciting for us because we get to hold events. We have things like this EMS Week competition. And actually, we had a crew go to the Empire State Building to light it, right? So if you happen to be in New York City, if you look at the Empire State Building, it's lit up in our colors. So take a look at that.
So there was one thing, a question that came up. I looked at the YouTube real quick on my little break there, whatever. Somebody asked, what's the point of this event, as opposed to having these members in the field, right? So I can say for us who have competed around the country, and we've also competed internationally as well too. We've noticed that these competitions also help us become stronger clinicians, right?
Yeah.
There's things that we probably didn't think about right away. There's different obstacles that get popped up. Maybe you get multiple patients, which is not unheard of, especially here in New York City, where we have over 9 million people that we can think of,
something like that. Yeah, for sure.
And we have only 500 ambulances running at any given time to treat 9 million people. Excuse me.
Yeah, the competition stuff when we were doing it put us in really interesting scenarios, and not all of them were ridiculous scenarios that were unfathomable.
I mean, we had a helicopter crash one year, and
That was the one that you and I competed together for.
and in New York City, how many of those have we had?
We've had those, yeah. Oh, and actually, hold on real quick. So we're watching one of the competitors go through the tunnel. Oh, we were yeah.
Yes.
So as you can see, look at the ropes on that, right? So, oh, he's crawling back out. So, yeah, just look at that. So that's such a tight space, and you have to maintain patient care, you have to do CPR, you have to do all this stuff, and the bags have to come through, for that matter.
I like how you notice like every team has had their own style of how they wanted to get through this box, right? Like there's not one way to get this done.
Yeah, I mean, it's interesting. Every provider, like, we have the core of what we're supposed to do, and we all have follow that threshold.
Foundation, right?
The foundation stuff, right? But everyone does have their own style about how they're going to approach it. Like, it's not deviating by any means, but you and I would intubate slightly different. I hold the blade slightly different from you.
Right.
Even doing IVs, so we would hold the angio catheter slightly different.
Correct. I mean, you can say like everyone has the same base, same foundation, right? Coming through the FDNY EMS Academy, right? They do that, and then once you're out in the field, I mean, essentially, it's on the member itself to continue, right? I've always said that no two medics are alike, right? For myself, for example, I was an Army medic. I was a combat medic in the military. So I may have different ways, as you already explained, of how I like to do intubations or IVs, anything like that.
Right.
I know you yourself, you practice medicine before coming into the FDNY as well.
And, going back to what we were talking about in terms of, like, what's the point of competitions and scenario training and all that, it's just to get the reps in, like Chief Newth had said. There were a couple of scenarios I remember when we were competing, and even scenarios over here, you could say, that aren't the most frequent. And some of that stuff goes out of sight, out of mind. And if you're not putting the reps in, when it happens in real life, you're going to falter a little bit. But we continually do training, and so when those situations come up, we're more well prepared. I know that early on when we started competing, I think I was competing with Kevin Ramdial, we had a situation where it was a burn pediatric or something with a pediatric, and I remember freezing up because it's infrequent, right? Thank God it's infrequent, but at the same time, that's what we're supposed to be trained to do, that stuff. And then by doing that competition, by doing that scenario, it made me reinforce my skills, and never had that problem again. I can tell you that.
I mean, I think we both can honestly say that treating children in pediatrics is probably one of the hardest things
Very much
to ask
so.
anyone to do, no matter what level you are, EMT all the way to doctor. I think just treating children it's just one of the most difficult things to do.
Yeah, 100%. And you can't take the human factor out of treating patients because these are real people, and that's what you're supposed to do.
These are somebody's family members, right?
Yep.
I mean, that's how I always say, you always treat every single patient as if they were your own family, right?
Yeah.
We both were raised in the city and stuff like that, so we had the opportunity of potentially getting our own family members as patients.
100%, yeah.
So understanding that this is someone's mother, someone's father, brother, sister, children, treat every single patient as if they're your own family.
Yeah, and ideally, that's why you want to be the patient advocate. That's why you want to do the best for your patient. And again, going back to the whole system thing, you want to get them to the right hospital, give them that definitive care. You want to do the best you can for them while you're on scene. And
so I'm glad you touched on the hospitals, right? This is probably like one of those misnomers or things that, the civilians don't really necessarily understand all the time, that when they call 911, they feel as if that they get to choose the hospital and that's just the way it goes. But you need to understand that we have a set of operating guide procedures and protocols set in place, right? Depending on what their nature of illness, mechanism of injury, and what's going on with them, the hospital they may be requested may actually not be the best hospital for them.
Right.
And them understanding that this can actually delay their care, right? Because if we take them to the wrong hospital, now we have to wait for someone to transport them to the appropriate facility.
And John, we're going to cut you off for just 2 seconds here. We're going to go to the screen and take a look at what's going on here. So we're at one of the patient care scenarios right now. So this is
like
the
the
pet
ALS
strap.
portion.
This is the pet strap, right? So for this scenario, we have it as a pet strap. The person was riding their bike, and I believe, I'm not 100% sure about this, the person was struck by a vehicle.
Yes, this was a bicyclist that was struck by a vehicle and is currently not on the ground. I'm not sure how their mentation status is right now. That's what the teams are currently focusing on. They're trying to ascertain that right now.
Right.
If you and I were competing right now, that would be like one of the first things we do. We come up to the patient and ascertain a mental status.
Right, that's the APU
Let's see if
scale
they're
stuff,
awake.
right?
The APU, correct, right?
And there's multitude of reasons why someone can be verbal, responsive, alert, unresponsive, and that's what we do, right? We have to ascertain those things. We have to do the investigation
Right.
by way of patient assessment, right?
And this is where also their gear comes into place, right? So if this is a real world situation, this could be on a highway, this could be on the street. We're looking at sharp objects, we're looking at blunt objects, we're looking at, potential fluid spillage from vehicles, things of that nature. So all these things, come into place to keeping us safe, treating the patients accordingly.
All right. And real quick, we're going to kick it over to Hemi Prasad, who's out there in the field. He's got a team he's going to interview real quickly, and we're going to cut it right over to him right now.
Hemi, you're on.
Hey, so I am here with Division 1 team. What station you guys representing? Station 8. Nice. So how was that scenario? Tell me about it.
It was a little tough. They threw us a curve with uncontrolled bleeding that I thought I treated, but just continue with my protocol. It doesn't compare to real life, but we did what we could.
All right, very nice. I'm hot, so I know you guys have to be even hotter right now.
Sweating. I might just become a patient soon.
All right, cool. All right, awesome, Randy. I'm going to send it back to you because we have another team loaded to go.
Alrighty, we're back over here. Just in chat, we got a couple of things. Hello from Germany. We got Germany watching us today.
Hey, I
That's
actually
fun.
competed in Germany a couple
You
of
did
years ago.
compete in Germany. I didn't get to go with
We
you.
did the European conference circuit. That one was actually interesting, right? Here we have EMTs and medics, and the European conference, they actually had nurses and doctors that we competed against.
Yeah, when we were competing in Prague, we ran into the doctors as well. Did we beat them?
We won in Germany. I just gotta say that, but we did beat the Europeans.
Yes.
But yes, shout out to Germany. Thank you for tuning in, guys.
Alrighty. So, we're back at the CPR, the obstacle course as they're pumping away over there.
All right, so going on right now, we have the team currently doing compressions on the mannequin. They have not yet placed their Lucas device, it seems. Looks like they're going to start setting that up as we speak.
Yep, they're moving that patient using that reeve sleeve.
There you go. Look at that proper communication, lifting with their legs, not their back. In one unison, continuing compressions. Look at that, no real delay on that. Good job.
And they lower the head of the stretcher to make sure the patient can stay flat, right?
Yes, I like it.
These are all the core things that really happen at the academy, especially for like those brand new, non-trained people who are going to become EMTs. Those body mechanics for lifting are really important. You got to really lift with your legs, right?
How many folks this is their first job?
For a lot of them, it is their first job, right? So, back in the day when we were still paramedics in the field, we didn't have the electric stretchers.
Don't say it like that. Oh my God!
I know.
Back in the day,
we're old.
I know. Been doing this almost 20 years. It's like,
yeah. What do we got? Like 40 years between us now?
Between us, we have 40 years of EMS experience. That's a lot to think about.
We're old.
But thinking about that, there's kids out here at 18 years old working. I have kids who are 21 and 18.
Yeah, I mean, it's pretty wild when you think about it, but more props to them because they're out there, they're doing the work, they're getting their reps in, and they're out there saving New Yorkers' lives, right?
Absolutely.
And, all the props to all of our EMS personnel who are out there, paramedics as well.
Absolutely.
But yeah,
and again, touching on the mental aspect, right? Something not to forget. Members need to understand that there are resources, there are people available for them when it comes to like these difficult assignments or anything like that. Because the last thing we want to do is take these things home to our family.
100%. I mean, as EMS providers, as medical providers as a whole, and almost, I believe, every medical provider out there, no matter if you're EMT all the way up to a doctor, you have to take care of yourself too, right? And that's one of those things that the Academy has been really, really good about. And the department's very supportive of that. We have CSU, we have other resources to help
Peer
ourselves.
support,
Peer support as well, right? Those are things that help us become better providers because we're taking care of ourselves too.
Yeah, I think we get so. We just get put on like auto mode. We kind of just work. We go out there, we just work, treating other patients. And I think at times that we forget that we ourselves are patients as well too.
Well, that was a real big benefit of why I loved having you as a partner because we spoke. We got to just let it all out with each other, tell each other like the problems that we're having on this job. And that's why it's so important on an ambulance to have such a good partner because you're going to be spending more time with them than almost anyone else in your life.
Absolutely.
In a very small cabinet of an ambulance.
Yeah, and I think that this is, to me, my opinion, the family is like super important, right?
Yeah.
Having a support system at home. right?
Yeah.
Because to me, the family is like the most important thing, you know. So shout out to the family members who are the support system for all our EMTs and paramedics out here today who are doing this. You know, the family members that did show up to come support their competitors and their family members.
Yeah, that's why you notice also during like the EMS graduations, fire graduations, PD graduations, there's always a section where they thank the family members because this is hard, right? We are first responders, and a lot of this stuff can be very, very heavy, but that support from the family is everything.
And
you really need
you
that.
alluded to it, you touched on it as well too. And unfortunately, that there'll be days that we'll be at work more than we're at home with the families.
Yeah.
So you know, you and I mean, we basically became brothers over the years, just
For
all
sure.
the hours and stuff we worked together.
Yeah, exactly. And, you know, we spend our holidays, our birthdays, our weekends with each other on the overnights.
Oh yeah, there's no days off in the 911. You don't understand. We're working
Yeah.
through holidays. We're working through birthdays, as you said, celebrations, anniversaries.
Yeah, and you know, we're sending love out there to all of our PD, FD, all the other first responders out there, military. You guys are doing the work, and you guys are making a difference out there, and you guys are sacrificing so much for the betterment of the people that you're serving. So we thank you, of course. And this is a great shot. Look at this. Look at all the people here who are viewing this. So a lot of those tents you're seeing right now are the division tents. Those are those spirit tables we were talking about earlier. It's a way for each division to kind of show off a little bit of their character. So to break it down, we have 9 divisions, right? Mm-hmm. Cool. So Division 1 is representation of Manhattan.
Manhattan South, yes.
Manhattan South, right? Division 2 is the
We have Bronx South.
Bronx South, and that's where we spent a good part of our career. Division 3, we have Brooklyn South, right? Central South. More central. Division 4, which is Queens. Division 5, which is Staten Island. We're not going to forget Staten Island. We joke and we say you're part of Jersey.
It's
But
South Jersey. But
yeah, you still count. It's fine. Division 6, we have Manhattan North. And Division 7, we have Bronx North.
Yep.
That's where we spend most of our time together when we were working together. Division 8 is Brooklyn North. Division 9 is Queens as well. And that's all the divisions. And they're all out
And,
there. Oh, wait.
No, Bureau of Communications. Don't
you
forget.
Oh, well, that's your house now. So,
Yeah,
I'll let
Bureau
you
of
talk about that.
Communications. Shout out to Bureau of Communications.
But they're all
BMV.
out there. They're all supporting. They're doing their thing. So, right now, we are over at the WMD. So, we're a new scenario over here. So, what you just saw was the use of a duodote. Now, the WMD scenario is supposed to represent what happens in a situation where there's exposure to organophosphates. So, again, most likely, hopefully, not going to happen here in New York. But, again, we're trained for these kind of situations. Now, the protocols are very specific based on the weight of the patient and using a duodote. So,
Weight, symptoms.
yeah.
You know,
So,
things
you
like
want to
that.
go through the duodote, like what's in there and what it's for?
So you have your 2-PAM and atropine in there, your pralodoxamine, that's what's it called in
Yep.
there. So depending on the patient's weight, depending on their severity, how we triage them, right?
Right.
How we color code them, that would determine how many duodotes we're administering
Right.
to these patients. Right?
Yeah, so for like a full-grown adult, you know, that's exhibiting signs of sludgem, right? That's the big thing they're looking for.
Ah, yes, sludgem, the big EMS word that we never really go
Yeah,
over.
you know who used to do that a lot was Dr. Gonzalez.
Yeah.
Yeah, he used to get us with that all the
Oh,
time.
yeah. He wouldn't let us just say the word
No,
sludgem.
no.
You had to know exactly what
You
it
had
was.
to break it down. Was it salivation, lacrimation, the whole 9, over and over and over again. Actually, let's see if we... Can I remember it now? Salivation,
lacrimation, urination,
urination.
defecation, upset stomach, GI, and meiosis.
Yeah.
Right, we used to go through all of these, just like our DCAT, BTLS, and things of that nature. Well, all
Yeah.
these competitors.
It's
are
all
learning.
these letters that break down to help you try to remember, and then at the end of the day, you'd have a lot of letters. Hopefully you remember what they mean, but that's the whole point
I
of
feel
training.
like us in the military, it's all acronyms.
It's a lot of acronyms, yeah. 100%. So, in the scenario that we're watching right now, again, it's organophosphate poisoning. They're out there pushing out the duodotes. It's a sludgem thing. So, for a adult, full-size adult who is exhibiting signs of sludgem and having some AMS, altered mental status, or respiratory distress, they would get 3 duodotes.
3 duodotes, correct.
Right? So, essentially, the sludgem thing is your body's reaction to the organophosphates. you're overloading the system. The synapses and everything in your body is losing its mind. So between salivation, lacrimation, urination, all that stuff, your body is basically just saying whatever fluid's in your body wants to get out.
Wants to get out, correct.
Yeah.
And we're trying to stop that.
Right. And that's where you use something like 2-PAM, which is an oxime, you have atropine, which is an anticholinergic. That stuff is going to dry the body and basically counteract those symptoms. Right? So you would use 3 of them. And for those who don't know, the duodote is essentially the same thing as like your EpiPen, right? It's a way to deliver medication by a needle.
Same delivery method, yes.
Yeah, and it's all encapsulated into this one device. So both medications are inside a duodote.
Mm-hmm.
You inject it. Generally, you would try to go for like the mid-thigh, lateral thigh.
Immediate portion of the body, yeah.
Yeah. And, you know, there are other places you can kind of use it too if there's issues about accessing those sites. But
I would say that one thing to be like wary or very important is that if something like this were to happen in the real world, then follow all directions from the first responders that are on scene. Just that's the best thing for our public out there is follow directions from the first responders.
And it's also important to note that because of the nature of this kind of job, you, as an EMT or paramedic, can say you can't just decide to do the stuff on your own, right? You need a class order from a medical director.
Right.
So what that means is that a medical director would authorize a class order, meaning everyone has now been activated in this particular space to utilize this medication. It's not a conventional medication that we just have on us to use. It's during special situations.
Oh, it's highly regulated.
It's highly regulated, along with our WMD truck, right?
Mm-hmm.
So we have a lot of vehicles out there outside of the ambulances. We have WMD trucks, MRVs, MRTUs.
They're regulated from outside agencies as well.
Yeah, for sure. So there are other things that would be deployed in this kind of situation. But obviously for the competition, we're keeping it pretty low-key. We're not going to bring the WMD truck out for this because it would set off all sorts of sensors. FBI would be calling us going,
so
what
let
are
me
you
ask
doing?
you, right? We've been doing this for a couple hours now, whatever.
Yeah.
Have you been having the same itch as I to just jump over there and just start competing right now?
I really wish we were competing. I miss it so much.
It's like I kind of want to put somebody out the way and just steal their bag and just get it going.
Yeah, but it'd be terribly embarrassing if we couldn't hang with them. But I do miss it. I do miss it a lot. Yeah.
But it's awesome, right? Just building a camaraderie with everyone. You know, like I said, we've traveled a lot of country and everything like that. And I got to say that it's like EMS in worldwide. It's just been like the greatest people I've ever met.
Yeah.
Right. We've had the same problems. We have the same cries, same issues, but we get along just alike, and it's just amazing.
That's one of those really big things about going to like conventions and symposiums, kind of like the Search and Rescue Field Medicine Symposium that Dr. Isaacs holds. There's a lot of teams that come in. It's funny. So just to touch on that for a second, there was a team from Mexico that came and drove 40 hours to be part of that symposium.
Oh wow!
And for those who don't know, that symposium is very USAR based. It's all about like urban search and rescue medicine, and there are international groups, domestic groups that are coming in to just learn from the FDNY and how we treat in these kind of situations. So
shout out to the USARs and the IMTs.
Always shout out to the FEMA
a lot
teams
coming up soon.
Yeah,
all the natural disasters, the hurricanes.
It's
the
almost that season, right?
We're coming up to that season. We are.
Yeah. For those who are interested. With the symposium happening right now, take a look for the 2027 Search and Rescue Field Medicine Symposium. Sign-up will be happening relatively soonish, but you'll see information in regards to those things. So definitely come down to New York if you want to hang out at The Rock, Randall's Island, at FDNY if you want to learn about those kind of things. So what do we got going on?
It's like there's a station that's resetting right now as we speak.
Oh, they're on reset?
That's what it looks like. Yeah, it looks like they're resetting right now. Which, hopefully they're hydrating. Today, it's definitely a hot one out here today.
Yeah.
These teammates need to be hydrating, especially that the gear that they're wearing, just their helmet alone adds an extra 10 to 15 degrees.
Well, that adrenaline's going through them, right? So they're not even feeling it, but that's one of those things you got to make sure that you're hydrating, make sure you're doing things right. But we do have staffers running around, making sure.
We have hydration stations.
We have hydration stations for sure. And I know that every division's ALS and BLS coordinator are going around with the teams to make sure that they're taken care of. So
I mean, we've been there, right? Like when we were still in the truck, we sat 4 or 5 hours at a fire, full gear, and I think literally we're just like sweating through our clothes.
Yeah,
you just you just understand. You don't have to be moving to just be burning.
100%. And we were paramedics, rescue paramedics together, and now we're captains. So we've gone through and promoted our way up, but the role doesn't change. Our job is still ultimately to help patient outcomes. Maybe not directly by doing patient care, but but for us, we manage a certain amount of people who are out there in charge of those things. So our job now is kind of to help support our membership to make sure they have what they need, right? So our lieutenants are out here too. Oh yeah, of course.
You, the family, you send your members to us to go to work. It's our job to send them back to you the same way you bring them to us.
Yeah. So one thing that's not super highlighted during these competitions is the role of our lieutenants and our officers who are out there. So let's take it over to the obstacle course, for example, right? So to make this really simple, let's suppose I'm the paramedic crew and John is representing the lieutenant on there. I'm going to be focused on patient care. Yep. I'm going to want to make sure the patient's taken care of. We're doing CPR. We're getting the medications. And what about the officer?
So my job at the officer is to make your job easier, right? So I have to step back. I have to not touch the patient. I have to literally just step back, look at the bigger picture. Right? My job would be more talking with the other resources, the firefighters. If we need some form of extrication, if we need to maybe cut down a wall to remove a patient, maybe there's the hanging wires or the hanging ropes that we're seeing there. This is where we would discuss with the other resources. This is what we need, right? Calling ahead to our dispatch group. Hey, what hospitals are available for this sort of patient? Giving notifications, right? Explaining these things so that they can call ahead, let the doctors know, hey, this is what we're bringing you. Get ready.
You know, it's interesting. We were talking about this a little bit earlier about the anticipator role, right? I think that the best, most effective officers, lieutenants that we have out there are those who play in that anticipator role.
Absolutely.
You know, because it's really simple, like when you conceptualize what we're supposed to do, right? Manage the patient, get the patient to the hospital. But if you're on the 8th floor of an apartment complex and you need to get the patient down, the logistics of getting that patient down, especially when we have all these additional members there who are trying to help this patient. You have the firefighters, the cops, you have us, and we're all trying to do the best for the patient. How do we migrate that patient down safely, efficiently, quickly, and then let the hospital know? So that's a lot of where the officers come into play.
Yeah, I mean, I can honestly tell you in all my years, the officers that I always loved the most were the ones that came on scene and the first words out of their mouth is, how can I help you?
For sure.
As opposed to just saying what we're doing, right? So those that come on, how can we help? How we can make this a better outcome for ourselves and for the patients? Those are the officers that I would follow into anything.
Yeah, 100%. And, you know, I'm going to shout out one of my old lieutenants. I had Stephen Growlow as a lieutenant over when we were at 2-7. It's funny, you think of the officers kind of being a little more disconnected from patient care.
Right.
I remember going to a job where a patient was showing to have acute pulmonary edema. I hadn't actually reached the patient yet. None of us had. We were right by the door, and he can audibly just hear the rails and the Ronchi and all that stuff. And he's like, oh, patient's in APE. And then he's just started managing the patient with us. And
that's where that experience comes from.
That's experience, right? And that's where, you know, playing anticipator, having the knowledge base, having that history, you know, being able to do that kind of stuff really makes you super effective as an officer out there.
Right, and I think that's another vital role too, right? So we do hot washes or after action reports.
That's really important.
Big assignments, right? Especially these mass casualty incidents, whether it's your big fires, whether it's a building collapse, some form of explosion, you know, just going back with the crews afterwards, whether you follow them to the hospital or you speak to them right there at the incident, and just having a hot wash with them and just saying, hey guys, this is what happened, this is what we did, this is what we could have did better, you know, these are things to work on, right? Training, right? This is always the way it is. You're always going to fall back to your level of training.
Right. Yeah, and that's one of those things that's super important for especially the newer members that come out from the academy that join us at the station level, right? We can talk about from the dispatch side as well, but again, experience teaches those who are less experienced. Right. That's the whole point of us, right? So I know that at certain stations you have like a mentor who will work with that person, and you have the BLS and ALS coordinators, which we can't shout out enough because they really do a lot of work.
Oh yeah.
But they're making sure that they're getting their internships done, that they're talking to them and making sure that their paperwork is good. But real quick, we're taking a look at something.
What's up?
I don't know. We're getting something from our producers. We're bringing a new interview. That's what's going on here. Alrighty. Fantastic. I'm excited about this because I didn't think you were going to come hang out with me. Introduce yourself to our fine audience out there.
Hi there, sure. My name is Lieutenant Thomas Durkin. I work at the FDNY Bureau of Training EMS Academy and was involved in preparing the competition component of what you see behind you.
Fantastic. So, let's go through it. What was preparation like today?
So today was surprisingly fairly smooth. We had an unbelievable army of Helpers came out yesterday. We set the field. We set out a lot of the cones for the obstacle course. Lieutenant Namu Kim deserves a ton of credit.
Yeah.
He set the props and the staging for the CTTF and WMD stations, which look spectacular.
We have Chief Basso hanging out with us also.
Hello there, Chief. How are we doing?
Chief Lou said to come see you. I don't know why.
Oh, really? I don't know. I have no idea why she would want you over here.
This is serious business over here.
Yeah. That. At some point, we're going to bring in Chief Basso to hang out with us. He is always dressed, by far, one of the most colorful people in the department. So,
so yesterday was a ton of work, but we had a ton of help. Some of our probationary members were here to assist us, and they did a fantastic job, which made this morning as smooth as it can go.
Yeah.
Early start to the day. It's a 0600 start time for us. Instructors, staff, assistants, helpers.
Yeah, and the prep work was insane. I mean, I got involved much later on, but the amount of prep work you guys were doing in terms of creating the scenarios and really thinking about how you wanted to make this super efficient and just great for the teams and visually stunning for us to watch.
Yeah, so, as much as this is a competition, it's also a celebration. So I think by sort of trimming down a little bit of the extraneous stuff and making this just really exciting and very applicable to what we do on a day-to-day basis. In addition to some fun, the obstacle courses are a little unrealistic, but they're just plain fun. The CTTF, the counterterrorism station, the WMD or nerve agent exposure station is stuff that's real to what people might actually see. So trying to make that as realistic and as applicable to what we do as possible. There was a ton of work that went into that. And we're super thankful to all of the different people that we referenced, the medical directors, the Special Operations Command, counterterrorism. We had tons of meetings with everybody. They were super helpful in adding insight. The Bureau of Training sees things from our perspective, from building scenarios and grading them. But Special Operations, CTTF, medical directors, they all see things from their perspective, so they lent like a ton of insight, which was super, super helpful for us.
I'm sure.
To making these things super realistic. And they're here with us. CTTF brought a ton of staff. They're helping us run. That kind of offloaded some of the staffing from the BOT and our end of
If we had the ballpark, how many people do you think we have helping out here today?
You know what? I couldn't even tell you. I can tell you.
It's a lot.
It's a lot. Maybe, I don't know, 100 plus just in the competition aspect alone. Again, probationary members helping us with running and reset. We have instructors, dozens of them, supervisors, and then outside staff coming to help us. We have,
and we got the ceremonial unit here as well.
Absolutely. Yeah. And then, outside of my kind of small corner of this, we've got the ceremonial unit, we've got the different divisions, we have the strong person competition. So again, just from my small corner, which is just the competition component, that alone has got to be, up in the ballpark of 100.
Yeah, and you're a huge factor of also why this stuff is running smoothly. So we really want to thank you because you put in a lot of work with a lot of members from the EMS Academy to make this run the way it's running right now.
Super happy to do it. It was, this is my first time being involved in this. Yeah. So, trying to build things from square one when I had to, but then referencing people who've done it before and calling in help where I could was super helpful. I did not do this by any means alone. Like I said, Lieutenant Namu Kim, who is floating around here with a clipboard.
Oh, he's running. I saw him a minute ago. He's somewhere out there.
Invented a ton of what you're looking at, and then the entirety of this staff, Chief Graham, Chief Newth, were integral in kind of bringing all these things together.
Was there any particular scenario you guys put together that you're more excited to see how the competitors will react to?
So I really like the scenario station themselves. So those are arterial bleeding stations. Very often scenarios, we like to build them over the top. It's really fun and very, very exciting. This year, to make things, again, kind of the theme, I think, at least from where we were building things this year, was to make it applicable to real life. And so with the scenarios themselves, there aren't 10 different patients. It's just one patient who's extremely critical, who requires really deft and kind of conscientious care. Some of the interventions that the crews are trying don't end up working out, so they have to adjust on the fly. One of our instructors, Stanley Coe, invented, kind of retrofitted one of our mannequins to bleed profusely. He built it from spare parts and Amazon and Radio Shack, and really built some things that are commercially available, but he was able to create it sort of out of
kind of MacGyver it. Does that date me by saying something like MacGyver?
Yeah, I think so.
I think so, right? Yeah.
But that station is super cool because it is as true to what we do on a daily basis as possible. One is a bicyclist who was struck by a vehicle and has an arterial bleed that needs to be fixed. There's a couple of twists and turns along the way, but watching the crews do what they do every single day and watching them do it really well is super exciting to me, especially my roots as an instructor, being able to see how people progress through their careers and just how well they work is really exciting. On top of that, the razzle-dazzle of the CTTF and WMD stations are awesome. And then I was responsible for putting together the obstacle course this year based on some stuff we did last year, paring it down. The other super fun thing that we did this year was we had our crews, we tried to keep the divisions moving together.
Yes,
so
I
in
noticed.
years past, ALS and BLS from the different divisions moved around independently. This year we tried to have the crews together as much as possible, partially for the time they were on the field, but also so that they could share their time off the field together, to enjoy the spirit tables, to enjoy all of the different affinity groups, to enjoy the food. And so by keeping the groups together, we kind of had to retrofit some stuff that we've never done before. Hence the reason we have 2 obstacle courses running simultaneously, which was a little bit of a change from what we've done in years past.
Yeah, for sure. And it goes to say that some of the scenarios that we're putting, that you're seeing happening today, are not completely dissimilar from the training that our brand new EMTs coming through the academy go through. It may not have the glam, it might not have the music in the background, but they are going through the same kind of training and going through those scenarios. And again, like as we said before with Chief Newt, it's to get those reps in to make sure that when time comes that they are going to be efficient at doing this stuff to help save as many people as they can.
Absolutely. One of the things, we see a lot of trauma in the scenarios and the obstacle course that we're running is that, time on scene is so critical, and avoiding extended unnecessary time on scene. And so even though this is a celebration, even though it's a competition, it is also practice. And so reinforcing time on scene being absolutely critical, moving with expediency, obviously care and safety being the priority, but moving with expediency, getting off the scene as quickly as you can is one of the themes that we try to run with our scenarios, with the obstacle course, and then the CTTF and WMD stations are slightly different.
Now that the competition is off and running and kind of doing its thing, do you have a chance to breathe now?
No, at like 4 o'clock when everything is wrapped up and the tents are away and everybody is off the field, I'll take a deep breath out and then, I don't know, sit in a cold room for an hour.
That sounds like a really good plan. Well, we're not going to keep you too much longer so you can get back out there and get some work going. Thanks for hanging out with us.
Appreciate it.
And we will talk to you soon.
Thank you.
Alrighty. All right, we're going to bring John back to speak to us and get back into our podcast here, or live stream rather.
Podcast, buddy? That's your other job.
That's my other job. If you want to see me on other things, I am also on the Join FDNY podcast and the FDNY Pro podcast.
Hit that like, hit that subscribe.
Hit that like and follow button if that's what you're into. We appreciate you. So
I'm back, buddy. What's up?
Let's get into this. So we got this cardiac arrest scenario going on right now behind us.
Okay.
They're moving that patient.
This team is finishing up. They're getting up into the ambulance portion right now, where they have to load in the patient. They just dropped down the bracket to lock in the automated stretcher. Yep, green light means good to go.
Yep. For sure. So you notice on the Lucas that the hands on this mannequin are raised quite far up. Right?
Correct. That's only because it's a mannequin, right?
Yeah, right. It's only because it's a mannequin. However, you would be tying those arms to the side of the Lucas like that, and that's basically to help facilitate that CPR from that device.
Right.
Again, you're not going to see that device on because it's not rated for use on mannequins. We don't want to damage the mannequins, but they are 100%
So we
going
also
through
don't
the
want the
process.
arms flailing around everywhere.
That's also a thing in real world, right? So, and that scenario is over. Very nice. We're kicking it over to the WMD. You can take a look right there. We have a couple of the pallets out there to basically simulate just like an environment to make it a little more loaded.
Looks like that is the only lieutenant team that's in there too.
Is it a
White
lieutenant team?
helmet that I saw in there.
There was a white helmet? I didn't even notice that. Oh,
you know what?
that's
Shout
it.
out to Lieutenant Macaraz for being the only officer who was brave enough to come in and do this against
That's
the
tough.
members that they supervise, right?
Yeah, you can't go wrong with that.
I don't think as a supervisor you ever want to look bad in front of your members, right?
No. I
They'd
don't
have a
think
lot
so.
to talk about if you couldn't get that intubation and have to go back to the station to
Yeah,
talk to them.
yeah. Street cred's important in our world. So let's go back, since we're talking about Macarats and lieutenants and all that kind of stuff. So we kind of went through it for the obstacle course for that cardiac arrest. Let's dive into it ever so slightly into more of like the MCI management thing.
Okay.
Right? So what we have going on behind us are more of like the almost more run-of-the-mill individual patient scenarios where you're taking care of one patient in a particular thing and you're moving on to a hospital. Now, we do have the RTF and the WMD. We're not talking about that specific scenario, but we do show up to larger events. MCIs can be anywhere between a fire, where we would respond with the fire side, with the fire trucks and all that stuff, and sometimes it could be car accident.
Yeah.
So
it could be a multi-car pileup.
Right.
It could be a number of things, right? School jobs, we've been having a lot of those lately.
Yes.
I mean, so you're alluding to the officer. So the officer role, right? In the officer role, you're doing zero patient care. And I think that's something that's very important for newer officers to understand, is you have to learn to put your hands in your pocket when it comes to that, right? Because if no one's managing this scene, you're not getting the proper resources that you may need, right? If you grab the first person that gets pulled out of a burning building and you start treating, you're probably not seeing the 3 or 4 other ones that are getting pulled out as well, and you're unable to call for proper resources to come and back you up, right?
Right. That's why the role of an officer or lieutenant on scene is they're supposed to just make sure the resources get there, right? They're the macro vision thing. They're going to look at the scene as a whole and say, we need these resources to execute this plan to get the patient to the hospital.
Right.
And it varies, right? Every agency has their own essential officer who's going to help manage for their perspective what they're doing, right? So
but
if
it's easy to have a script, right?
Yeah.
But as soon as one critical care patient gets dropped in your lap, I mean, it's now is when you fall back to your level of training, right? Because the script kind
I
of goes
agree.
out the window at that point.
Yeah, and this is one of those things that you and I spoken about in the past where it's very much the difference between someone that's good versus someone that's great is a person that never hits a wall.
Right.
It's not to say that you have to know everything. By no means are we saying that that's the way you have to be. It's difficult. The whole job is difficult, and it's way easier to kind of foresee problems and find a way around it. You know?
Right. I think this is one of those where you should always be doing something, right? So
Agreed.
when it comes to the competitors right now, one of the things that we've always trained or we've always done, we've always said that if your hands are not constantly moving, if you're not constantly speaking, you're missing something.
Yeah.
Right? And I think that kind of translates over into the real world in these mass casualty situations that you're speaking of, right? If you're not constantly speaking to someone, if you're not constantly getting information or updated information or investigating, you're missing something.
Agreed, for sure. And again, for those who are just joining us at this given moment, we are here live at the 2026 EMS Week Competition here at Fort Totten. My name is Captain Randy Lee. I'm joined with
Captain Jonathan Rivera.
And we've been just going through the play-by-play of what's going on behind us. We have the EMS Week Competition. We have multiple scenarios going on. We have an obstacle course that has a CPR component. We have an RTF, CTTF scenario. We have a WMD scenario. And we have 2 patient care scenarios that are going on right now. The competition started before the stream started. We actually had the teams out there doing a Cahoots test, which is basically just a written test to test their knowledge on anatomy, physiology, operations, pathophysiology.
But they did it Jeopardy style this year. They made all the teams go against each other at once.
Oh, that's what happened?
Oh, yeah.
I didn't even realize
it
that.
wasn't individual cahoots.
Oh,
they all
okay.
went against each other.
So they Jeopardyed their way through?
Whichever division was the smartest, hopefully the Bronx, a little biased, but, whichever one was the smartest, and that's the ones who came out with the most points in that section.
Yeah, and again, it's one of those things from a training perspective. You have to have the book knowledge, and you have to have the quote-unquote street knowledge. You have to be able to work on scene, but to draw your information from somewhere to make sure you have the best patient outcome, right? So.
Yeah, I mean, they both go hand in hand, the didactic and also the hands-on component as well, too,
100%.
right? So, all right, let's see. What are we looking at now? Looking at us.
I think we're in transition mode between the next set of teams going out
teams
there,
are still
right?
resetting.
Yeah. So the way it's working right now, there are about 20-minute blocks, we'll say, where the teams are all coming out at the same time, and they're going to compete in their individual respective stations, and they'll get as far as they can, and then time will automatically stop, and then they'll have to reset the stations. So we watched a few scenarios go through already. We had a few going through the obstacle course and whatnot, and they are going to go reset, take a little break, and then they come right back out to compete again. So we have other events going on behind us as well, but just besides the competition itself. We have spirit tables where Division 1 through 9, all of the city boroughs are represented here, and they're kind of just showing off their style, doing super cool, style-y things with their tables.
We also have the strongman competition going on as well, too.
The strong person competition over there. They are literally pulling ambulances. That's ridiculous.
Yeah, no, you wouldn't catch me doing that. I'm sorry.
No. Unless it was downhill and neutral. Well, no, I'd probably get run over. That's not going to work that
King
way.
of the North is walking behind us.
King of the North?
Yes. We have a whole wolf behind us as we're speaking.
I don't know if we're going to catch it on video when it walks by.
I don't know if we'll be able to see the wolf. Hopefully he walks by with it, but oh my god, that's a beast.
Live streams are interesting. There is a giant...
There he goes. Look, walking by. Look at that. King of the North. There you go. Look at that.
That is
a massive... I don't know if you can see it on the stream.
Can you see it on the stream?
Look at this, the cutest. Look at this.
Oh my god, you're humongous.
I'm sorry. I like animals more than people sometimes.
Oh my gosh. So that dog is humongous.
Hey, buddy.
And
get you some water.
All right, buddy, come on, let's go. Let's get back to work.
That is a
live streams. Gotta love it. All right.
It's a massive animal.
That was a very large dog. So what we have on the screen right now, that's one of the ALS coordinators that's talking to the team, just helping them along, probably just giving them a pep talk or something.
Hopefully giving them bottles of water and some food as well, too, because they've been at it for a lot of hours so far.
Yeah. Donning and doffing PPE is part of the competition. We've done it that way for a number of years.
It's a skill in itself.
It is 100% a skill in itself, and when it gets hot, it gets really hot. So we're going to start getting in a new guest. We're going to bring in Chief of the EMS Academy, Ian Swords. We're going to have him sit with us, and we're going to talk with him a little bit. But excuse us as we bring him on in. Hey, Chief, welcome. Thanks for joining us.
How are you? Very well. Thank you for having me.
Alrighty, so how's it been going so far for you?
Excellent. It's a beautiful morning here at Fort Totten, watching the best of our best compete to win the title of best ALS and BLS team. So everybody is working really hard and playing.
Can you get a
really
little
hard.
closer to the microphone, actually? Just sorry, because I hear the stream is getting a little funny.
Everybody's working really hard and playing really hard and trying their best to prove that they are the best of the best.
Right.
So it's a beautiful morning here at Fort Totten.
And as the chief of training, and I think I heard you talk a little bit about this the other day too when we were at the Search and Rescue Field Medicine Symposium.
Search and Rescue Field Medicine Symposium.
There you go. Doug Isaacs is going to be so angry at me. I keep messing that up. EMS training has evolved throughout the years. So take me back to I guess when you were EMT versus the way training is done now.
That's a very, you're correct. There has been a lot of changes in how EMS training has evolved over the past 25, 30 years. When I first took an EMT class, it was 2 nights a week for 6 months, and out on the road we were. And I was an EMT before I came to the FDNY. But then when I went to paramedic school, the paramedic program I took was 9 months, part-time outside of the department.
Yeah.
And in the past 25 years, EMS training has evolved to add on more skills, more capabilities, the ability to assess and determine more critical situations and conditions. So the training has evolved with that. So now we look at the paramedic programs are a minimum of a year here at the FDNY. It's an accredited, COAM's nationally accredited program, which is the national accreditation body for paramedicine. Other places throughout the country, it's the same accredited program spread over 2 years. So EMS training is evolving more and more, and actually turning more into the higher education realm.
And the scope of practice has expanded quite significantly since then, right?
Correct. Yeah, absolutely. We just starting with the ability to detect acute myocardial infarction in the field,
right,
which is something we take for granted today, because
right,
every paramedic unit and every paramedic everywhere has a 12 lead EKG.
Yeah.
When I first started as a paramedic, they were just introducing them into the field. So take a rough guess you were having a heart attack. Now we're providing, our paramedics are providing the initial proof of a heart attack,
right,
and starting the whole in-hospital treatment before they even leave the scene, which
right,
that in and of itself has saved so many people that we can't even calculate because
right,
of the treatment they have received, because the paramedics have detected they're actually having a heart
right.
attack.
And we were kind of talking about this before, myself, and Jonathan. You heard that? That's double. But how we basically will take that information, give it to our doctors, and so they can send it to the hospital. So the hospital's completely ready, so they can get them to the OR, wherever they need to go, get to the cath lab, and really get that care going.
Yep.
So it's great.
A lot quicker, and time saves muscle, time saves brain tissue.
Sure.
Even with stroke care as well, just the advancement in pre-hospital stroke assessment and our notification process with our partnership with the local hospitals.
Yeah,
it's come a long way. I mean, so the medicine in EMS has evolved and continues to evolve. Definitely.
Yeah, and so being the chief of the academy, and you're watching these guys go through all these trainings and scenarios. Obviously, we kind of do the same thing with our Pro B EMTs, the ones who are coming in who want to be EMTs for this job. It's a lot of book knowledge. It's a lot of skills-based things. How do we kind of make sure that they can take those skills and apply them to the real patient?
The first thing we have to do, if someone wants to be an EMT, once they start EMT training, and this is usually I call it the week 1 wake-up call. Mm-hmm. It's not a first aid class. It is an actual medical certification beyond first aid. They're learning actual anatomy and physiology.
Sure.
How the body works, how different disease processes manifest themselves acutely in emergent settings and chronic conditions as well.
Sure.
So that's usually the first wake-up call is, wow, this is actually a lot more than I thought it was going to be. But applying that and coming in with that with the right attitude, you can succeed. The other thing that I'm watching here that I love is we're seeing the different levels of training succeed, from the Pro B EMTs who are in the probationary EMT training program out there doing their stuff, all the way up to the paramedics doing the ALS stuff. So we're seeing the whole spectrum of pre-hospital care here, from the very beginning all the way up.
It's such a great program because, again, we have so many people here. We have the Pro B EMTs who are helping support, so they're starting to be part of our family.
Yeah.
We have the EMTs and paramedics who are now out there competing, plus their BLS and ALS coordinators who are supporting them, plus all the division, plus ceremony, plus media, plus everybody that's here, all the chiefs. It's a big family effort.
It is, and that's a really good way of putting it. It's almost like an introduction to a lot of their other family members that they've been hearing about for the past couple of weeks. They've been, being brought into our culture and brought into our family in a strict paramilitary style, because that's the world we work in.
Yeah.
Especially given the threats in the world today. So for them to see the kind of gentler, not that we're mean, but the the gentler family side of what the FDNY is really about, and how we look out for each other no matter who we are. You wear the patch, we take care of our own here. And I'm seeing a lot of that exposure to that here, and people smiling as opposed to doing push-ups and all the normal,
for sure,
necessary training things we do.
And it's exciting to see, you have the family coming out. Like you said, a lot of times the families don't have the ability to kind of really visualize what it is that we do.
Yeah.
And, with scenarios like this, different from scenarios in the past where they're almost like Universal Studios level, crazy events, right? They're able to see, the regular day stuff. And we do have some of the crazier events, obviously, because those are fun.
Yeah, you got to have the crazy stuff to live.
Yeah.
But that's important because the everyday stuff is where our people truly make a difference. So I mentioned earlier, there's heart attacks. Plenty of people, unfortunately, have heart attacks in New York City every day that our folks, treat and identify and do an excellent job saving lives with cardiac arrest. I mean, it happens every day. So it's those everyday little jobs. So bringing that into here really helps teach the family members and the other members of the public. This is a park. There are people walking around. What we really do. We don't just take people to the hospital really quick and drive fast anymore.
Yeah, right, yeah. Have you had a chance to go around to the Division Spirit tables?
I went by a couple of them, and I was really impressed. It really it's amazing.
Chief Basto happened to stop by earlier in his interesting inflatable
He walked
costume.
by, and I had to talk business with him, and I It's like, we'll talk later, Mr. American Flag. God bless.
Yeah.
He's looking great.
Is he supposed to be one of those inflatable things that you
Yes,
see at the car
like
dealership?
a car dealer, like-
yeah, okay. So he's a giant balloon car dealership guy, no problem. Oh,
But
man.
again, it goes to show you how we can still have a good time as serious as this job is, you know?
I mean, this is a super great event. Again, the families get to come down. We have our chiefs out here, our divisions out here who are really showing off their character and their style. You know, we want to thank you for allowing us to have this event over here every time, and you know, your support for allowing us to have the competition here, plus all this additional stuff. I know the affinity groups are here this time too, which is great. We have the strongman competition over there, who's just pulling ambulances, which is ridiculous. But yeah, is there any particular scenario over here that you're extra excited to see?
I am extra impressed in the one where they're actually in PPE on the other side.
Yeah.
And watching how they're operating. Just given the heat, it's a little warm here. It's not warm, but we don't have to wear PPE. We shouldn't wear PPE, but it's still challenging in the sun and the heat, just to see how they're rocking it over there.
Yeah, and the communication is paramount between these competitors. They're definitely making sure they know what their partners are doing and what's great for the patient, and they can transfer as soon as possible. So it's exciting to see. It definitely is. So at what point are we going to get you to climb through one of those little tunnel boxes things?
Oh, I can do that. I haven't done that in a while, but I could do that again. Yeah.
All right.
Even SCBA, I'm there.
Cool. So I already got Chief Newt saying that she's going to compete next year. You're going to be on the team with her?
If we do that, absolutely.
Heck yeah, that's the way to do it. All right. I'm not going to keep you much longer.
We'll
I know
show you how
the
the bosses. We can still do this.
I know you
we'll
can.
We'll show you how we will rock you next year.
I'm 100%. I know you can drop a 2 better than most. Well, thanks for hanging out.
Thank you very much, Cap.
We'll catch up with you a little bit later on.
Yes.
All right. Take care. Alrighty. Again, that was Chief Ian Swords of the EMS Academy. He's the chief of the academy here. Welcome back, John.
Hey, buddy. How you doing?
Alrighty. So
Nice. Are you jealous? I get breaks and you don't?
I mean, you know, I'm like the podcast guy. I'm used to doing the camera stuff. It's fine.
Oh, man.
You know.
So
First of all, we're on transition right now between the next teams coming out, right?
Yes, they're still resetting all the stations. I think all the instructors are hydrating right now, resetting all paperwork and equipment. So let's see. We'll give a couple more shout-outs. Looking at the page. Oh, look.
You checking out chat?
My daughter reached out. My dad is in this. Shout out, Jade. Love you, baby.
And we are monitoring chat, so if you want to send us a message, by all means.
Yes, we are looking. Sorry, we're not, responding to everyone. There's a lot going on over here right now at this current moment.
So let's take a look here because we are live. We're at 11-ish right now. So the obstacle course has got a break right now. I think Division 9 is going to be running out there.
So
for
there's a break built
scenarios.
into the obstacle right now. Yep.
Yeah. For a reset, obviously. And
and I mean, listen, just because the instructors are not competing themselves, they're standing in the heat, they're resetting, they're moving, they're constantly working. It is hot out today. One of the nicest days we've had in a while, thankfully.
Oh, yeah. And we got both Queens divisions out there on the CTTF WMD course as well as scenario course. That's what you got on the screen right now. That looks like the WMD course. Yeah, they're doing it.
Yeah, it looks like right now they're going to the WMD portion of the scenario. That's what we have on the screen right now.
You can kind of see in the background we got Chief Tompkins over there playing the hype man on the microphone. So we're in control of the live stream. We're here to talk to you fine people. And we have Chief Mario Tompkins out there hyping up the crowd, making sure that everyone's jived about all the events that are happening right now. So it's super fun.
Yeah, that's a lot to do, a job in itself. Just hyping everyone up, keeping that same energy from the beginning. I mean, he's been going at it since, 8 o'clock in the morning?
Yeah, he's just hyping everybody up and, just trying to keep that motivation going.
I don't have it in me to be going on for that long. I don't know.
We're doing this the same time I do.
True.
So, again, this is the WMD scenario we were talking about earlier where they have to utilize the duodotes, get that 2-PAM, the atropine in there to basically help reverse the effects of the sludge-em effect from organophosphate poisonings. So that's what we're seeing right now. As you can see, the instructors are out there. We have feedback judges. We have scoring judges. They're all kind of doing their thing, making sure that they record all the points and make sure they're doing it safely. That's really important, right?
Yeah, and I think this is good. From the station and division standpoint, building up some camaraderie with your fellow workers and everything like that. Another way for the for the officers, as you've mentioned before, to kind of appreciate their members and what they're doing today, because it takes a lot to come out here and put yourself on the line to compete. in front of your coworkers, in front of your bosses, in front of your family members. And this year, being live streamed, that's a lot of pressure in itself. So, huge shout out to all the competitors for doing this.
Yeah, it's true. And what you see on the screen right now is one of the pediatric mannequins, and we were kind of alluding to this a little bit before, but having trauma and medical issues it's not mutually exclusive just to adults, right? So we do occasionally we have to take care of pediatrics, infants, neonates, and that's part of it. So a lot of times when we're doing the medication thing for someone smaller than an adult, it becomes weight-based. Right. So that's not in the case of it is in the case of this particular scenario, because under a certain amount of weight, the protocols will dictate that you give a little bit less of the medication. In the W&D scenario, it's basically one less duodot, depending on the patient criteria and whatnot. So
yeah, I mean, it's a little less forgiving when it comes to children, right? It's just kind of why we have to do this weight base, right? Because not every 8-year-old is the same as the next 8-year-old. I mean, you have some that are just like Wembanyama, 7'5", and then you have some who are just Allen Iversons and little guys.
Those little people.
Yeah.
Yep.
So little people need love too. But this is why we come along with we have the weight based dosing and everything like that. But children always pose a particular skill.
And real quick from the chat, we're going to give a shout out to one of our guys from the Middle East, currently deployed out there. Thank you for your service. We appreciate you. Thanks for watching.
Be safe. Get home safe. All right,
and they're utilizing that duodot. So it's a little bit different. So depending on the weight, so it's hard to tell because obviously it's a mannequin, but the weights do change between. You have the smallest size, I guess, 18 kilograms, and then you go from 18 to 40 kilograms, and then anything past that is just the full-size adult. And we do a lot of things in the metric system.
Yes.
Yeah. So most medicine is not necessarily done in the imperial system because it's just, medicine is worldwide. So we generally use the imperial system just because number-wise it's a little bit easier to manage, and the increments are a little bit smaller. Right. So therefore you can actually give a much more precise dosing by using milligrams, kilograms, and the like, and same thing, milliliters, and all that stuff. So, and again, in this particular situation, they are using auto-injectors, so it's pre-dosed. It's kind of like an EpiPen, but when other situations, we will actually be drawing out that medication. And med math, as we call it, can be pretty loaded sometimes.
I mean, you got to imagine if you're pulling out this kit, if you're cracking open the seal and opening that bag, it's a bad day for everybody.
100%.
So do you really want to be standing there that day and trying to do math?
Yeah.
So to have these, auto injectors already pre-filled, pre-dosed, just essentially helps everyone. It's just a better outcome for the patient.
Yeah.
It's better for us, because although we've been doing this, each of us 20 plus years each.
Yeah.
I mean, an emergency still kind of gets you on your game,
Right. And there are tools that we utilize to kind of help do the medicine a little bit faster. I mean, we have Brazil tape.
Right.
And I believe the teams out there were actually issued out Brazil tape to make sure if they wanted to use it, they could use it. Brazil tape is essentially just a
link-based dose device.
Link-based dose device. No, but this time we actually have Brazil tape.
Yeah.
So it's basically just a length-based dosing device that has this color-based chart based on length. You would place it next to the patient, and whatever they fall under, the rest of it has the list of the medications and the correct dosage for that length of the patient.
Yeah, it just makes it so much easier, especially like newborns, anything like that. Right, we have an APGAR score for them.
Yep.
Which.
Alrighty, so we're gonna just. Sorry about that. I had the producer talking in my ear right now. Okay, cool. So we're gonna take a little break. We'll be right back after a short little commercial.
Today, we're going to talk about one of the most important things you can do when escaping a fire, and that's close the door. You know how when you're in your room, being too noisy and silly, or singing and listening to music with the volume up high, or maybe you're watching something and it's much too loud, your parents might tell you to close the door, right? To keep the noise contained, to keep it from reaching the other room.
That's what happens when you close the door when there's a fire. The smoke and fire is contained and can't spread as quickly.
Or have you ever seen a big gust of wind come along and slam a door shut? As soon as the door closes, the wind and pressure changes. the wind calms down and stops flowing.
Just like if there's a fire, closing the door to a room or an apartment that's on fire will help stop the flow of air, heat, smoke, and fire from spreading as quickly.
Come to think of it, do you know what flow means? Flow is when something goes from one place to another in a steady stream. Well, closed doors help stop the flow, the stream of air, heat, smoke, and fire from spreading. Here's another example. When you take a bath, you have to stop the water from flowing out of the tub with a stopper. Otherwise, the water will just drain out of the tub, right? Well, your apartment door is like the bathtub stopper, and the water is like the smoke and fire.
The door stops the smoke and fire in its tracks. And don't worry, firefighters have special tools and equipment, so trust me, they can still access your apartment or room to fight the fire.
That's right, Chloe. Now, we talk a lot about escaping a fire and closing the door. But there are situations and certain buildings where staying put in your home is the safest thing to do. It depends on what kind of building you live in. If you live in a high-rise building or a building with sprinklers, and the fire is in an apartment far away from you, staying inside may be less dangerous than entering a smoke-filled hallway or stairwell. The best rule of thumb is to follow your building's fire safety plan and listen to the instructions of the FDNY.
You know, we've been hearing a lot about close before you doze. What does that mean exactly?
Doze. Right, like doze off, go to bed, fall asleep. We recommend that you close before you doze. Now, doing this really protects you if a fire breaks out in your home as you sleep. You are more protected from fire, smoke, and toxins behind that closed door.
Close before you doze. That's catchy and easy to remember.
And safe.
Alrighty, and we are back. We are live here at Fort Totten celebrating the 2026 EMS Week Competition. And my name is Captain Randy Lee, joined by
Captain Jonathan Rivera.
And we are here to give you the play-by-play about the competitors and all the things that are happening here today. So, to give you a rundown, we are here at Fort Totten. They're doing the EMS Week Competition. We have teams from all across the boroughs representing Queens, Brooklyn, Manhattan, Staten Island, and, of course, the Bronx.
Communications.
Communication. And communications. Well, I leave that for you because you work at communications. All right. So we have multiple scenarios going on right now. We have an obstacle course that has a CPR component, cardiac arrest component. We have an RTF, CTTF, which is like the more tactical style thing. And then we have weapons of mass destruction, as well as patient care scenarios that involve multiple stabbing victim as well as a ped stroke. So depends on if you're ALS or BLS, paramedics versus EMTs, which scenario you're going to get. So we've been going at this since I think 9 in the morning. Actually, before that, because they had a cahoots.
Yeah, the team started with their didactic first. They took a couple of exams. It was Jeopardy style where they all went against each other. So it's just, winner takes all in that portion.
Yeah, and just kind of testing knowledge against knowledge at that point. And now they're out here testing their skills.
Yeah, I don't know. For me, I've only had 1 cup of coffee. I might not have done well in the knowledge portion this morning.
Yeah, that stuff, it's funny because when you look at questions in a non-testing environment like that, you can take your time and everything's fine. But when they flash a question on the screen, you got to hit a bell or whatever it is and just answer it. It's not always the easiest thing.
It's amazing what a clock and a clipboard does to someone, right?
Yeah, for sure.
We do this every day. We're constantly treating patients every day. But put a clock and a clipboard in front of someone and it's just like, oh.
It's gone.
It's like catching flies.
Instantly gone.
That's it.
There'll be the word that it's right there, and that's it. It's just gone.
Yeah. And then, add on top of that, your supervisor's watching you. maybe your spouse is watching you, your children are watching you.
Yeah.
And it just adds on to this. So the fact that, they came out here, they volunteered to do this, it's amazing. So again, I can't say it enough. Shout out again to the EMTs and medics that are competing right now. You guys made this event what it is, and a shout out to the family for supporting them, because you guys, without your support, we just can't do what we do here.
100%. And of course, we're going to give it a little shout out over here because of all the staffers that are over here today. We have the EMS Academy Ceremonial Unit. We have OPI here from Digital and Media setting up our stream for us. Thank you. We have the Strongman competition over there. We have all the divisions over here, ALS coordinators, BLS coordinators, just so many people who want to make this event what it is. And the amount of work that went into this is astronomical. They really do start this right after the Pre's event. Probably in a couple of weeks they'll start getting ready for 2027. It's a lot between trying to make dynamic scenarios and something that's quite fun for the families to watch as well. So,
Right. I mean, you got to make it fun. You also got to make it realistic, right? Not everything could just be cinematic and everything like that.
Yeah,
we have
for sure.
to taper it more to what we actually do on a day-to-day basis.
Yeah.
Which I think today, shout out to Chief Graham and her staff. I feel like they really did a really good showing this year.
Yeah, and it really is a celebration. Again, we have the divisions over here. They have something called the Spirit Tables, which is a way for them to kind of show off their character, and it's under the EMS Week slogan of this year, which is, what is it again? See, it's like a test. I just totally forgot. I blanked.
Together.
Huh? Something together?
Nice, Randy. You're the one that's supposed to remember these things.
I'm supposed to remember it, I know, but I said it so many times, and now I'm blanking.
We're going to get it tattooed on you, right? Because I have no space since I'm all covered up. So we got to get you...
I got room over here.
Put it right there in your arm.
Yeah.
I'm going to write it down for you.
Yeah. Well, we'll go through it. All right. So, what we have on screen right now, we have CPR happening for cardiac arrest scenario. This, again, is the obstacle course. And we were kind of going through it a little bit earlier, but chest compressions in a cardiac arrest scenario is paramount. This is the stuff that's really going to improve patient outcomes. So, pushing hard, pushing fast, allowing for full chest recoil is the hallmark of proper compressions. Body position is really important too, because you could very well injure yourself. And for those who, luckily, hopefully have never had to do this in real life, it's exhausting.
Oh, it's physically exhausting. I mean, just, again, the gear itself just adds a good 20 to 30 degrees more on top of, the ambient temperature right now. Your helmet adds another 15 degrees on top of that. So it's just, again, proper hydration, being properly physically fit as well, too. This job is physically demanding,
and, more power to them because they have so many people watching them.
Oh, yeah. I mean, right now, I'm sweating for them, and I don't even have on all the gear that they have on.
And as you can see, they're in their PPE, their turnout gear. It's just a little bit of extra. Again, if you scan for tan, if you're ever in New York City and you need EMS, that's what they wear during major incidents. Conventionally, you'll see us in regular uniform. Maybe dark blues, maybe light blues, maybe white. Depends on what what our role is.
I like that. Scan for tan.
Scan for tan. Yeah,
like
Chief
that.
Newt said that. Apparently, that's an old school term.
I like it.
I didn't know about it, but
I thought
now
we
I
were
do.
old school.
Older school.
Look at all these kids out here. I feel like we're
they're
old
so
school.
young. Good for them.
Is that old school?
We're the old-ish.
So
school.
we're the freestyle group, and that's what
pretty much
doo-wop and blues, or how old are we saying?
Jazz.
Jazz? Yeah, there you go. By the way, Randy said it, not me. Just so you know.
Just kidding.
Get back to work.
Please don't transfer me. Shout out from the chats. We got Benny Brio over there.
One of our rescue medics has been on the job going on 20 years as well, too. I've trained with the man.
Hi, Benny.
Awesome guy. Awesome medic. Thank you for reaching out, guys.
So the way it's working right now, they're in 20-minute blocks. For every 20 minutes or so, another group of competitors will come out. They'll go through their respective stations, and they will kind of move on from there. Again, right now, you can see there's a little bit of reset going on, I think. Is that right?
But I love the support, the members coming out from the divisions on their day off to support their fellow competitors, their fellow co-workers. It does show a lot. It shows a lot of love, a lot of camaraderie.
And they can't see it from this angle over here, but we have one of the competitors over there with their family. It looks like a bunch of really adorable little kids giving them a good hug right behind you, John. And that's great. The family stuff, right? So, really, really cool to see. It's really exciting. And
but this is a great event that the department put together, right? Along with the foundation and everything else. You have bouncy houses, you have rock walls that I can see from here that's set up for family members.
Yeah.
You don't have the barbecue and the DJ. So it really is an actual family event, right? It's not just a competition.
Correct.
It's actually a full family day event.
Yeah.
Where we can, acknowledge the members of what they've done on an everyday basis for the whole year. Like, yes, EMS Week is 1 week, but in actuality, like, you know, we accept and we support our members all year round.
Correct. And that rock wall is up already?
Yep, rock wall's up.
Oh, yeah, they're putting it up right now. Thank you for the NYPD for supporting us by supplying the rock wall.
Are you going to try that later, Randy? You know you like rock climbing.
I do like rock climbing, but I'm not going to try and embarrass myself with these boots. So, I'm also wearing this very, very tight shirt, which I can't climb.
It makes you look slim, sir. You're
Thank
good.
you. I appreciate you.
That.
It's a slimming color.
Okay.
Yeah. So, as you can see right now, there was the floor. Oh, there you go. Better. So you can see those blue shirts right there. Those were given out to all the members of the EMS Academy who are helping out staffing this event. So
yeah, so we have the staff that was properly delineated. Paramedic Rafael Cicada that just walked up to us.
Yeah, that's why when you have live stream, people will just come up to you.
So happens when we talk to people.
Exactly. So as you can see right now, we have the obstacle course on the screen. So part of it is when they have their patient on there, they actually have to go through this tunnel. It's more of not the training of going through a tunnel. It's not like we go through tunnels every night. But this is more training of communication, working together to get the objective done.
Yeah, I mean, it's just another way to kind of like introduce stress inoculation, right? Because it's really hard to kind of like reinvent or recreate real life scenarios.
Yeah.
So we have to kind of add outside stressors.
Yeah. And for those who are just tuning in right now, myself and Captain Rivera, we're part of the FDNY EMS competition team where we've traveled domestically, internationally to compete in competitions all around the world. And one of the greatest things about these things that we were alluding to before is just the ability to kind of artificially recreate pressure.
Yeah.
Scenario-based training is one of the most important things that we do as first responders, and all first responders do scenario-based training. And the point of it is to get your reps in, to do your skills, to do them efficiently, safely. But during competitions like these, I think it's really interesting because you're now artificially creating that pressure. That's one of those things that you can't always get when you're in the classroom setting. So doing events like these, I think it's really important for you to help elevate your game as a first responder to really take it to the next level of efficiency.
Yeah, and you know, it's something that actually tests you and everything like that. And I think things like this, when it comes to stress and it comes to trauma and everything like that, I think it brings us closer as a service as well too.
100%.
Right? That's something that when we've traveled and we've competed, we've gotten very close with our competitive teams, right?
Yeah.
Teams that we still speak to day to day. We haven't competed in a couple of years, and I can still say that we still speak to the members from other states and everything.
Oh, 100%. Yeah, I mean, between all the Florida teams, Cumberland County, Sussex County, all these guys that we've competed with throughout the years, we have
our Capital Health group, we have the Merit teams.
Yeah,
shout out
Merit,
to all those guys.
Shout out to you guys, of course. But camaraderie. It's all camaraderie, and this is internal for us, for the FDNY EMS family, but doing competitions out there, going to conventions and symposiums are a really great way of just expanding your horizons to the other agencies that are out there, because EMS is EMS anywhere you go, and we all have the same situations we run into, same follies, similar protocols, and it's interesting to... Same goal ultimately, right?
Mm-hmm.
And we are trying to improve outcomes together. See, I did it.
Yeah.
I had to throw it in there because I remembered the slogan. Improving outcomes together. So real quick on the screen, because I like highlighting this, we have that Lucas device. So you're not going to see him turn it on because it's not rated for use on mannequins, but it is a way to facilitate CPR while you're moving a patient. So in the given scenario that you have over there, the patient was found to be in cardiac arrest. They began care on the patient by way of doing chest compressions, managing the airway, and just getting ready to transport the patient. From a medic perspective, their situation will call for intubating the patient, establishing intravenous access, and giving first-line medications, which is epi. So, as you can see, the teams are now just packaging the patient and getting ready to transport the patient. Now, again, hey, thanks, chat. We got a couple of shout-outs in the chat out there, just calling it out, everybody. So thank you for joining us. Obviously, this is the first time we've done a stream like this, and I think it's going well.
I think so. I mean, look, we've been going at it for a few hours now. So, again, definitely, I want to say it again, shout out to the live chat. Those that have been adding comments in there. Thank you for your kind words. We do see it. We do appreciate you guys.
And thanks for all the chiefs, as well as FDNY Foundation's Executive Director Gene O'Shea for joining us earlier. Again, the FDNY Foundation does support a lot of events from the FDNY, including this EMS Week Competition, as well as the Second Chance Celebration. Basically, almost everything. So we really thank the FDNY Foundation for supporting us. So, being that it is EMS Week, how it kind of works for a lot of us is... Oh, wait, hold on. We got to see this movement. So, as you can see, the teams are moving through with their patient. In theory, that Lucas device is supporting chest compressions. They're working as a unit, moving the patient.
Working together, communicating. Look at that, nice and slow. Again, slow is smooth, smooth is fast. You know, we always say that the emergency is over once we're there. You see them walking together, communicating. One person is strictly involved with ventilations. The Lucas device itself is handling the compression, while the other two members are moving the device. They lower the device to get through a low-profile situation, and they're continuing through.
Yeah, and again, we threw in like these little injects of the tunnel and the low-angle stuff for communication purposes. It's not like we walk under bridges or anything like that all the time, but the whole point is for communication, coordination among your teammates, and then ultimately getting that patient to the hospital by way of our fine ambulance. Actually, they're right behind us.
Yeah, so I think that, this is another good thing about this competition, and the fact that we're actually live streaming it this year too. This is something for the public to see what it is that we actually do, right? Because there's always that question: what is it that EMS does?
Right, and there are some misconceptions out there, I think, but having events like these are a really good way of just highlighting our skills and what we do for the public.
Right.
Yeah.
So it's just not just a ride, right? We're actually coming through. We're actually performing life-saving interventions, life-saving treatments.
Correct.
Right? Whether you're having an asthmatic attack, something like that, cardiac events, right? Someone again, like you said.
All right. So, thanks for joining us on this live stream. We're going to take a short break, though. We will be right back.
Last thing I remember, I'm not laying in the bed with the phone like this. She said she just heard the phone fall. I fell off the bed.
He just held his head up, looked at me this way, and he just passed out. He was not breathing, and I knew right then that I needed to perform CPR to get his heart pumping. I directed the kids to call 911, and I also asked them to help me move him because he was not in a position where I could turn him over onto his back to start CPR. I continued, and then the 911 operator said, just keep doing what you're doing. Just keep doing CPR. To the first responders, I am tremendously grateful. I started it, but there was help. Thank God there was help.
She was the first of the first responders. That's why I'm here today. Yep, I don't know what to say. I'm so thankful. Without her that night, I wouldn't be here for sure. She gave me a second chance in life.
I was CPR trained about 9 years ago, and when this incident happened, it all came back to me. I remembered everything, every step. I do believe it's important to learn CPR. Every minute counts, every second counts. You never know when you're going to be in the situation where you need to help somebody. You never know when you need to save a loved one.
Back. Welcome to Fort Totten, everybody. We're here for the 2026 EMS Week Competition. We've been streaming it all day, talking to some of the management here, the chiefs, Gene O'Shea from the FDNY Foundation. My name is Captain Randy Lee, hosted with
Captain Jonathan Rivera.
I don't even know if that was actually the correct terminology, hosted with. That sounds wrong. Whatever, but you know what I meant. That's
it worked,
fine.
don't worry, I liked it.
Shout out from the chat. We have shout out to someone's brother, Clay Tejada. Went from EMT to instructor to paramedic. That's great. we did that. Maybe not exactly that order, but yeah, we did that too.
But that's a nice progression.
That is a nice progression. So maybe down the line, Tejada will become a lieutenant.
We'll see.
We'll see. Hopefully. Oh, I guess they're competing out there today, maybe, right?
That's potentially maybe one of the competitors. I know we have a competitor list somewhere here. We just haven't looked through it as of yet.
So on the screen right now, you can see the obstacle course. Right now they're on reset, but let me give you a rundown how that all works. Oh, actually, we got a group going on right now. So that looks like the WMD scenario. They are wearing their APRs, attaching that canister.
Oh, wow. The muscle memory just to do that, the dexterity that's involved. When you're stressed out, look, there you go. Working together, buddy system, see?
That's
you
the way to
come to
do
the
it.
competition alone, you came as a team, work as a team. Excellent.
This looks like an ALS team.
Excellent.
One of them's HASAC.
Yeah, they're doing great. They're working together as a team. I like it.
So for those who don't know, we have HASAC and Rescue. They are part of the EMS Special Operations Command. They're specially trained in certain environments. HASTAC specifically kind of deals with more the WMD situation, which is what that scenario actually is. It's an organophosphate poisoning. They're going to have to deploy the auto-injectors. And
I mean, yeah, you know, they handle hazardous materials and everything like that. If you switch over to the rescue medics, these are more specialized tactical medics, I would call them, right? They're going into those situations that not your everyday medic is probably going into, right? They're operating on a fire floor itself. They're going into collapse situations, trench rescues, specialized things that, you can only go in with probably minimal equipment, minimal communication.
Yeah, for sure.
Excelling there.
Huh? And we're going to be cutting over to our field reporter, because we do have one of those. We haven't seen him in quite a bit, so we have to give him a little bit of
I think he's been
time.
taking a lot of breaks. I don't know.
He's taking breaks, right?
Huh.
See, if we had him in a white shirt, he would feel more official. But he's
that's what it is. He's
yeah,
blending in.
He's in the
everybody.
light blue right now, just hiding away. That's going to be Lieutenant Prasad. We're going to be cutting over to Lieutenant Prasad in just a second. He's actually interviewing a lot of the competitors as they're coming out, so we're getting that first-hand knowledge of how it feels like to be in this competition. So it's super cool. Did we ever have to do that?
What's that?
In competition, did we ever get interviewed directly after? I know before we had.
Yeah. Oh, absolutely. So the last gems, shout out gems. But the last gems, as soon as we came out of competition, I had the trauma physician actually pull me and start interviewing me right away.
Oh, that's right. I do remember that scenario. Yeah.
Yeah, people don't understand how difficult that is because, your adrenaline's pumping, things are going, your fine motor skills are kind of gone, and then bam, right away, hey, what'd you do? Why'd you do it?
Yeah, and it's interesting. So for some of these scenarios, if they actually finish it in a really, really efficient time, there's actually a portion where they're going to have to be speaking, I think, to a medical director or to maybe the hospital staff, giving that patient presentation, right? And that's actually a really big deal in our job because continuity of care is really important for us. So we're going to go back to talking about that in just 2 seconds, but we're probably going to kick over to Hemi Prasad, Lieutenant Prasad. He's interviewing a team right now. Yep. And we're going to kick it over to Hemi Prasad. Go for it, buddy.
All right, so here I am with an all-time favorite, Division 6, where I first started in Harlem. I had to interview the team. Just want to know, how you guys feeling?
Very sweaty, but we did amazing. We worked together. My two amazing partners right here, they did great. Hello. That's Angie.
Hey, everybody.
That's Henry. Division 6. Go, Delilah Woods, Station 16.
So, how are you guys taking the day? How's it going right now? How are you guys feeling with the whole competition? Are we going to take number one or what?
I feel like we're having fun, but, we obviously want to win because we're really good. So, we're Station 10.
I believe it. Yes. I believe it. Division 6, they're heavy hitters. Yes. I absolutely believe that. All right, guys, make some division pride for me. Man, some noise.
Woo! Station 10!
All right, Randy. I'm going to send it back over to you now.
And that's Hemi Prasad interviewing the teams. As you can tell, they're super hyped up. They want to represent their divisions well. You can still kind of hear them. They're cheering away. But this is why we do this. This is why we have these competitions here. We have the divisions show up, their families show up. It's a way to really celebrate the EMTs and paramedics here. They're just doing their thing, and it's exciting to watch.
I think right now we still have some teams that are currently setting up. We have one team right now currently going through the course. They're getting ready to navigate through the obstacle canister that had the hanging ropes, which kind of simulates hanging wires and such. It looks like they're going to go with pushing in their trauma bag first, while one member crawls in head first.
Yeah, earlier today we saw someone going feet first through there.
Yeah.
That's an interesting technique. Maybe they did too?
Oh, yeah, look at that. They already had one member across.
Yeah.
He must be one of the shorter guys. He got through there quick.
Yeah. That's it. I remember going through that tunnel. The ropes really do trip you up.
Yeah, you seem like you have a plan and everything like that, and then you just kind of get snagged.
Yeah.
It just like throws you off.
Right. And I remember when I went through this tunnel the first time, I think I got caught up somewhere in there, and like the tip of my helmet just barely caught onto one of the ropes, almost knocked the helmet clear off my head. But that's why we wear chin straps.
Oh yeah, absolutely. And I know, when we were in the rescue world, we had rhino mounts, we had the flashlights mounted and everything.
Oh, yeah.
It was just all those things just all add snag hazards and pinch points and things of that nature. Just things just to focus on, and this is why we train, right?
100%. And as you can see, the teams have managed to get those teams have managed to get the patient out of that tunnel, and they're continuing CPR at this point, which is really important. Oh, and that other teammate just got out.
Yep. So that's a Division 6 team right there. You can see that she's walking around with her banner. Nice banner that they made.
Oh, yeah. Look at him
Captain
go.
Brady.
Oh, that's it. So, as we're watching this competition, this competitive team go right now, they're managing CPR. That's the most important thing in a cardiac arrest. You can't really see it from the angle that we currently have on there, but they're going to be applying that Lucas device, and that is basically a supported device to do CPR on the move, so it's safer for us, better for the patient, and we can get the patient to the ambulance as quickly and safely as possible.
I mean, if for those that are watching, if you notice that we keep harping on the scenario itself, the CPR component, as EMS, it's probably one of the most important aspects of our job that we do. Compressions, and stopping bleeds. So those are probably like our most important to get them to that definitive care in the hospital, right?
Oh, yeah, 100%. I mean, ultimately, at the end of the day, we want to do the best we can for our patients, and while we do so much in the field, ultimately, we are part of a larger system, and we're going to get that patient to the hospital so they can get that continuity of care.
Yeah.
And again, shout out, we're over here at Fort Totten. We're going to shout out some people. We have the ceremony unit. You can probably hear a little bit of that music in the background. We have Chief Mario Tompkins out there hyping up the crowd, playing the MC out over there. We have digital media setting up this fine live stream for you all to check out what's going on. Again, obviously, shout out. We have the teams out here competing, and I just got to shout out.
Like I said, we know so many people. So
we have so many people here.
Just the way it is.
Yeah.
So shout out to the competitors.
We just interviewed her, so it's fine. But the teams that are out here, they're competing. We have ceremony unit, like I said. They really help set up a lot of these things. But a lot of it happens from the division level and the EMS Academy, who got here really, really early and even started yesterday setting up the courses, setting up all this stuff so we can have this competition for the members and for their families, honestly.
Yeah, so, we're talking about one of the things that we can go over. It's like our patient assessments, right? How we start off, right? We always focus on the airway, the breathing, the circulation, right?
Yeah.
But now there's times where now the situation is more trauma-based, and we have to flip that, right? We have to start with circulation first, and then go airway breathing, right?
Yeah, and we see that in the scenario a little bit further up behind us. We have that pet struck plus the assault that has multiple stabbings. And they really do have to manage that bleed. If you guys can hear it,
I love it. I love the screaming. I love the chanting, the excitement. I mean, that's literally what it's all about, right?
They're making a lot of noise, supporting their division, supporting their teams. That's what we like to see. That is a massive crowd of
and
people.
the fact that they've been able to keep that same energy for the last 4 or 5 hours is amazing.
100%.
I want whatever they're having because that's amazing.
That's super cool.
But yeah, you alluded, you talked on the BLS competition, right? The stabbing victim, whatever. That's where like that scenario, that assessment kind of gets flipped around, right?
Right.
We're gonna focus more now on the circulation first, stopping that bleed.
Right.
Right.
And you know what's a really interesting part about that scenario is that there's actually extra points that you can gain by transporting the patient off the scene quickly.
Right.
Because that's really, really important. You're not supposed to really sit on scene and be treating a trauma patient when you can get them definitive care. They need to be in the OR, they need to be at the hospital, and we will render a lot of care for them. Obviously, we put on tourniquets, we do all that kind of stuff.
Thank you. I'm glad you mentioned the tourniquets. I was just going to ask you. So, what are some of the things that we do to stop the bleed? Right.
Right. Oh, so I thought you were going to tell me. Sorry.
Nope. Sorry, buddy.
Misunderstood
You're
that
on the
one.
spotlight there.
Oh, okay. So obviously we have tourniquets.
Okay.
Right. Tourniquets are. Everyone knows what a tourniquet is. when we first started, if we didn't have commercial grade
We had
tourniquets,
to make our own.
We had to make our own. You would have to take, a cravat, take like an OPA, use it as like a windlass, and you would kind of make your own tourniquet. Now we have commercial tourniquets. We have all over the place. We have a lot of them now.
We have Alea's bandages as well too. Pressure dressings. We have combat gauze. A lot of things a lot of things that we get derives from military medicine.
Yes.
Right. We look at especially our trauma, right? Because generally military, you probably most people are most fit and everything like that. So we really get like our trauma-based medicine a lot from the military, and we kind of trickle it down into the civilian world.
Yeah.
And combat gauze, as you alluded, was one of those things. I know when I started in the military years ago, our quick clot in our combat was actually powder.
Right.
And we realized that was probably not the best thing in the world, because if the wind blew, there goes your powder.
Right. There was also like a thermal reaction that happened with those
There
old
was.
versions.
So if you were sweating, it would go through your gloves.
Yeah.
So we realized that probably wasn't the right thing. So obviously medicine evolves.
Yeah, of course. And, for our rescue medics out there, we have transexamic acid, which is a medication that's injected, actually. Well, not injected
Helps with
per
clotting
se.
factor and
Yeah,
everything
so
else.
it actually affects the clotting cascade.
Mhm.
So there are a lot of different tools at our disposal for these types of situations. And depending on the scenario, and depending how well you're trained, you will get different things to help treat people. As you can hear in the background, you have the teams really chanting. Not the teams, the divisions chanting for their teams. It's really great to see that people are coming out to support their divisions. It is loud, it is proud, and it is very, very FDNY.
Yeah. We definitely want to reiterate for the public, if you ever encounter situations like this, where we have the pet trucks, we have any of this, how important it is to immediately activate the 911 support system.
I tend to accidentally forget the fine work that our EMD does, Emergency Medical Dispatch. They are literally the first that will interact with you during an emergency situation. And since you work there, why don't you give us a rundown on how it works?
Yeah, so when you initially call 911, you first get activated to a 911 operator, mainly PD operator, so we can get more information on what it is that's going on with you or your loved ones that you're calling for. We then, triage accordingly and then move it over to either whether it's fire, EMS, PD, to the respective. So, we'll focus on the EMS section. When you get it in the EMS section, there's like a fine line of questions we need to ask you, because we need to get you the proper resources in a proper amount of time. And it's imperative that we can just get these things, quickly as possible in plain English. We do, while we're taking these questions, we already have an ambulance on their way to you, but getting those questions just helps the crews to, mentally prepare themselves as to what it is that they're walking into. And then once it's dispatched over, you have constant communication with us, with your unit that's on the way to you.
Yeah, it's important, and I tend to forget about you guys. I'm so sorry.
No, it's
because
fine.
I'm so used to being in the field. We almost take it for granted, and I think a lot of people do take it for granted, the work that EMD does.
Yeah, I mean, it's stressful in itself, right? Because, imagine taking that phone call from a mother that has to treat their child.
Yeah.
Right? Or the family member that's not breathing, and having to be that, clinician on the phone to, coach this person through these things, whether you have to coach someone on the phone on how to properly perform compressions,
Right.
how to properly perform CPR,
Right.
How to properly, depict what it is that's going on. It's like, people tend to forget the mental aspect, but the patient care really starts at that 911 phone call when
100%.
EMD gets it,
Yeah.
and then it gets dispatched out into the field.
Yeah, and, we do recognize them, especially during Medal Day. We've definitely given out multiple awards to the dispatchers out there who have really, gone out and just told somebody, explained to them, instructed them how to do CPR on their loved one, and that is not easy.
No,
that is
not
a lot
at
of
all.
pressure.
No, that's not something that any person should ever have to do.
Right.
But unfortunately, it's just we have those situations where they come up. So it's a good thing that we do have dispatchers who are trained, who are EMTs,
Oh, yeah.
who are medically trained to actually talk you through these procedures.
Yeah, 100%. And shout out to them, because we don't shout them out enough.
There you go. Love you guys.
Yay. Alrighty. So
moving on. What are we at? So we have a team right now that's coming through the obstacle box right now. Looks like we have 2 members through. And I see an instructor looking in. Did we get somebody that got snagged? Or are we trying to work this out?
I don't know if anyone actually got through there yet. This is definitely a BLS team. We can tell from that green bag over there.
Yeah.
So, unsure if they actually had one. Oh, there it is. They got through. There you go.
Got through. Okay, awesome.
So if you're approaching this, how are you going to get through those ropes? So, okay, sorry, before you continue, just in case our viewers don't understand. So within that box that you see on the screen right there are ropes zigzagging across in all sorts of different ways, purposely to trip you up. So
simulating down wires, anything like that, down debris, anything like that. Again, it's really hard to recreate real life scenarios, but this is just one way to kind of induce stress inoculation. Excuse me. But going back to your question, as you said, how would I approach this situation? So I think first we'd have to stop. There is 3 of you, probably have 2 members constantly treating the patient, while the one looks at the obstacle that you're probably going to go through. Making mental notes. Am I going down? Am I going
recon.
left? Moving things over. And I think that one of us would probably go through first, while another one passes over equipment. Any equipment that's just not necessary, pass that through, and then just verbally cueing the next person coming through. If you and I were going through this, I'd be telling you, Randy, watch your head, maybe duck down 3 inches, move over to your left, things of that nature.
Historically, when we've had this competition in the past, we've utilized this tunnel box in the past, and there's some interesting ways people have gone through it. I think they mitigated it a little bit by having the patient go through as well. I know one year we had a BLS team that went through. They used a scoop stretcher to raise up all the ropes out of the way. And I thought that was really, really smart.
It was amazing. They were able to speed right through that.
Yeah, and, there's nothing wrong with that. Part of our job is to find unconventional solutions to unconventional problems.
And this is what I like about these competitions, right? Because now, what's to stop a crew in the field to do that in real life? They come up to this. What's to stop them from using this device to actually, raise up now? Right?
Yeah.
We said it. We've said it that we've gained ideas and things from members competing.
100%. And, not everything that you're going to see on this screen today is going to be the most optimal way of doing things. It's because we're training, we're practicing. These are scenarios. We're going to try different things to see if it's going to be the most efficient way. I know that one year going through the box, a team had basically clipped the bags to, I guess their belt or their leg or something. And their initial plan was to go, to the corner to get away from the ropes. And if their body could fit through, so could the bag. So what they were planning to do was basically go through and basically have the bag, the medical bag they had, kind of drag through with them, follow the same path where their body went. Did it work? Kind of. It wasn't the most perfect way of doing it, but it did. It wasn't
Could
either.
You say it was out of the box?
It was definitely out of the box because they got out of the box. It worked. Did it work the best way? No. Did they try to kind of revamp it? They did. And that's the reason why we train. That's the reason why we do certain things like this, because it's the little minutia things that can make or break whether or not you're going to do something really, really fast or you're going to do just moderately good. Right?
I mean, we learned, again, you and I played in the rescue world in a SOC battalion. We always learned that your shoulders is the widest part of your body, right? So if your shoulders were able to fit through a certain obstacle, the rest of your body was going to make it as well, too.
Yeah, 100%. Yeah, that's why we had those swim maneuvers and things to get through the beams.
Mm-hmm. Yeah, the low profiles, reduced profiles, things of that nature. Shout out again, hashtag instructor staff.
Oh, yeah. EMS SOC. Shout out to you guys. You guys are awesome. Not many of them are here today because they are still over at the Rock at Randall's Island because we are also concurrently running the Search and Rescue Field Medicine Symposium. So that's a really cool event where it's basically very USAR based, but we have teams and it's not a competition thing, but it's a symposium that basically help fosters sharing of information in regards to those special situations. So we have people from Canada, from Mexico, from all around the world who are coming in, and there's some really, really amazing lectures. It stems from, actually one of them yesterday was talking about FIFA and how New York City is going to be responding to those issues. So really, really cool stuff, really cutting edge stuff also. They were talking about nanotechnology for blood control, which I thought was really interesting. So yeah, there's a lot of advancements that happens in medicine that, we'll utilize too at some point. But, as those things advance, that sharing of information is really, really important. Even using plasma product or blood product for the help of trauma patients, it's out there. And it will be coming to New York at some point too, because FDNY is going to deploy that. And I think we're going to take a short break. We'll be back right after this. Thanks.
Thank you.
Welcome back to Fort Totten. We're here at the 2026 EMS Week Competition. My name is Catherine Lee, and we have a special guest. We have Chief Patrice Edwards here with us.
Hi!
So, Chief, how's it going so far?
It is going amazing!
It's super fun.
Yes.
Yeah.
We got a lot going on here, a lot of good energy. That's what took me so long to come to with Randy.
I know. It's crazy stuff going on right now. We have all the teams out there competing. We have the spirit tables. I didn't get a chance to see the spirit tables at all.
Gorgeous.
Yeah?
Gorgeous. So this year we have the chronological order. So it's 1 through 4, and then we have the PSAC table.
Yep.
And then we have 6 through 9. It's gorgeous.
Right.
Beautiful.
And, of course, we include PSAC, the
Yes.
dispatchers, because I may have forgotten them a couple times on the stream by accident. Sorry about that. I really do apologize. But, yeah, so the slogan this year is improving outcomes together.
Yes.
And that's kind of like the model they're running for their tables, correct?
Yes. Every table has envisioned what that means. Some table, like Division 4 per se, they have putting the pieces of the puzzle together. I
Right.
thought that was dope.
That's smart.
Division 3, they did it different. They have all of these different photos, action photos of all of the members of Division
Cool.
3,
Yeah.
live photos, and then they have like little giveaways and stuff like that. So it's pretty dope. It's unique out there.
That's
I love
awesome.
it.
You know
I
what's
love
funny?
it.
When they were setting up earlier, I saw like a balloon fly off. It had a giant 6 on it. And I was like, well, Division 6 doesn't have their balloon anymore. That's terrible for them. But there's a lot of balloons.
Yes.
They've been planning this stuff for a long time. And you're on the EMS Week Committee.
Yes, I am.
So walk me through it. What is like that planning situation
Whew.
like?
It is 6 months of headache.
Oh, yeah.
For all of this, and it's worth it.
100%.
It's worth it. So we come together and we collab on the ideas. Every year we try to expand it more and more. This year, of course, because last year and the year before that
Yep.
was so successful, we did things like Carnival and we expanded. We have something for the kids because the competitors are out there and they're working hard. They bring their family.
Yeah.
So we wanted something to get back to their family. So we have a section just for the kids to keep them busy the entire time.
Uh-huh.
We have food, as you can see. Loads
Yep.
and loads of food. We have the spirit tables. We even have games for adults. We have like a
Yep.
little mini
Like-
splash.
Oh,
That's
do you
like a
do?
bunkhouse. Yeah.
Oh, wow.
We're going to do tug of war, officers against the members. So
Oh,
we
I got to get in that.
Yes.
Oh, yeah,
Yes,
we're going to
we
do this.
It's gonna
We're going to beat those members.
And then we got the music. We got everything going.
Yep, and we got Mara Tompkins out there playing MC. Chief Tompkins is crushing it as always. Ceremonial Union, we're shout out to them because they're playing DJ to us and they're playing really cool music that you can't hear because of copyright strike. Sorry about that. So, you know, it's a really cool event. We're having a lot of fun out here.
Yes, we are.
We also have the strong person competition over there that the cameras are a little bit too close over here. We can't show you it, but they are pulling ambulances. We'll tell you that much. Super cool stuff. Also from the chat, hello from Staten Island, Chris Bell. Hi. Big shout out to Jersey ish.
Big shout out.
So all this stuff is going on.
Yes.
It's getting now. It's kind of like in its flow.
Yes.
Right.
Yes. Now it's flowing. Yes.
Yeah.
This is what we've been waiting for. I'm sorry.
No, you're fine.
For the past 6 months. This is what we've been waiting for. So now that we have everything all set up and going live, now everybody can get to enjoy it. The
Right.
festivities.
And you know what's really interesting? So I used to compete. I did the EMS Week competition back when it was held at headquarters.
Yes.
And it was a very different vibe. The simulation was a little bit different.
Yes.
They had these much more like Universal Studio level
Yes.
situations,
Yes.
like a plane full of asthmatics crashing into a baby powder factory, or something really ridiculous like that. Now, you could argue that the situations here, the scenarios, are a little bit dialed down. I don't know about the WMD; that's pretty dialed up.
Yeah, it was
But
a little crazy.
it's a little open, right? So the families are able to come see their family members. You get to see, I think it was Division 1 over here, Manhattan, shout out to Manhattan. They're making a lot of noise for their teams. And this is really, really why we do this, is because it's a way for us to celebrate our own membership.
Yes.
We got to thank you because we know it's not easy to set up all this stuff. It totally is worth it.
It's totally worth it.
And the committee, they're not only setting up this competition.
No. We're not only setting up the competition, we're responsible for the gifts as well.
Yep.
We're responsible for the poster. We're responsible for the pins. We're responsible for highlighting all the events for the whole week.
Right.
I have a calendar that we created, and I I outlined each division, each station of what they're doing, so we can support.
Right.
You know, we have everybody coming out to support the commissioner. Everybody wants to join and be a part of it and celebrate EMS.
Because everyone loves a celebration.
We rock.
Yeah, and so if you want to check out what the poster looks like or the EMS Week pin, you can definitely check us out on our socials, Facebook, YouTube, Instagram. It's on there.
Yes.
Take a look. Like and subscribe. Hit the bell notification. That's what you're into.
Yes.
Thank you.
Yes.
Also, if you join our YouTube page, you can always stay updated. We do live streams during certain events, especially like fire alarms out there. We will do live streams from there, so you can get updated from us. Which is always really interesting to see. So shout out to Digital Media, Joe Mabeso and his team, really out there doing a lot of really cool work. So we appreciate them, of course.
Love you guys.
So as of right now, we got the teams going. They're competing.
Yes.
We got their families out here. We got divisions out here. When are we looking to get the results of this competition?
It should be around, I'm going to say around 1.
1 o'clock? Okay, cool.
1-ish, 1:30, because they want to judge the tables.
Sure, of course.
And then they have the big outline, the whole spread up with the trophies and all of that. So I'm going to say about 1:30 to, depending on the time.
So while you're on the committee, you're not the one like making the scenarios, right? You're leaving that to the EMS Academy.
So the academy, builds out the scenarios. It would be Chief Graham in her
Sure.
team. So the way we have the committee, we sectioned it off with people who are in charge of certain things.
Sure.
I'm in charge of the gifts, the carnival section. Majority are helping up this whole setup and layout. Chief Graham, because she's assigned to the DOT, it's easier for her to oversee the committee
Of course.
for the competition. So it's a collabo thing.
Right.
We all have our own separate little portion, and then in the end, we put it all together like a puzzle.
Makes sense. It's one of those really important things that we are such a large department with so many members. It's really important that we have leadership like you and all the other ones that you're going to see come join us later on today, that they work together to make events like this possible. And it's great for our membership. As you can see, as you've seen today, they're out there, they're competing, they're doing their thing, and I think the families really benefit the most. It's great.
They love it. They love it. I have people over there asking for prizes now. Come out, have fun, get your prizes and all of that.
And you said there was stuff for the kids. I can kind of see the rock wall from here, but it's a little far off camera. But what else do we have for them?
So we have a rock climb wall. We have a game truck. We have 2 bounce houses. One is an obstacle course. The other one is a castle. We have.
It's not an obstacle course with a patient on it, right?
No.
Okay.
No.
I just wanted to make sure.
We have an inflatable basketball area. We have all different carnival games. There's the dart game. There's the throw the can, I guess the beanbag.
Oh yeah, sure.
We have
Now, where do we get the rock wall and the bounce houses from, anyway?
So NYPD works with us every year, and they love us. So they let us hold the rock climb wall because, of course, we're still here.
Sure.
And the bounce house, that's my connection.
Very nice.
Every year.
See?
Really cool.
Get to know people.
Yes.
So shout out to NYPD. Thank you for bringing the rock wall. We appreciate that.
PD, thank you.
I would climb it, but I don't want to fall.
Me either.
So yeah, no, not with this uniform on. Not going to do it. So, do you have a front runner? Who do you think? Who are you supporting?
Division 3.
Oh wow,
Division 3.
I was going to put you on the spot, but that was really easy.
Division 3. I'm faithful.
So shout out to Division 3.
Shout out
That's
to
Brooklyn. Right? So shout out to Brooklyn because we technically both work in Brooklyn. I just happen to be in Division 8. But shout out to Brooklyn, shout out to Queens, shout out to Manhattan, shout out to the Bronx, always the Bronx because that's where I stayed most of my career. Staten Island, you exist. We recognize you. We love you too. So that's awesome. So fantastic. When do we start working on next year?
So after this.
Tomorrow?
Yes.
Pretty much. Yeah, pretty much tomorrow.
After we start cleaning up and all of that, we actually have a hot wash.
Cool.
Right after to say what was good, what wasn't good, what we're going to improve on. We're thinking about next year while we're in this year meeting. 2027.
Well, you're going to be able to have some fun during EMS Week, I would imagine, because EMS Week is not just for the paramedics and the EMTs, it's for all of us who work as first responders in this field. So are you going to be doing any events, going to any of them?
I am actually going to be going to the local station.
Cool.
Division 3, I'm hosting an ice cream party for them. We're going to have the ice cream truck come out.
As you can hear, the team's out there. They're celebrating themselves. Good for you guys. So you're gonna do ice cream party?
Yes. We're gonna have a ice cream truck come out and give
Cool.
all of the members free ice cream.
Amazing.
For 2 hours straight in the tour 2 hours straight for the tour 3. And then I'm going to have 12 pizza pies delivered to each station.
Fantastic.
So everybody can eat. I know one station I'm really excited about going to, Station 7. You should check it out. They're going to have an art gallery.
That's amazing.
I thought that was such
great.
a dope idea.
That's so cool.
The members are creating art, and they're having their art gallery for the whole week to celebrate EMS Week.
That's
so I'm going to go
wild.
to the stations this year and show support and love.
Yeah. So on top of that, so it's not all just pizza and ice cream. There's actually going to be a blood drive out of Station 5-7. I know about that one.
Yes, the blood drive I'm going to too. Sorry, I forgot.
No, it's only fine.
Yes, the blood drive.
So, of course, we're going to support our community as well. So blood drives are important. We do blood drives here in the FDNY, and we suggest if you can donate, please donate. It helps a lot of people.
Yes, it does. Yes.
Yeah, fantastic stuff. So, I think that's actually, we're getting towards the end here. Maybe I think the teams are almost done, but we're gonna keep streaming. We're gonna keep going with this, and we're gonna. At some point, we're going to get you some winners here. We're going to see how all of our divisions did, and then we'll go from there. So, we got all this stuff going here at Fort Totten. Just to remind you guys, we're here live at Fort Totten for the 2026 EMS Week Competition. So, thank you for joining us. We appreciate you on this super duper cool stream. And again, we have Chief Edwards here.
I'll see you guys soon.
Thanks for joining us.
Thank you.
All right. Thank you so much. We'll see you on the next one. All right, cool. All right, we'll bring John Rivera back in.
All right.
Thank you, Chief. Appreciate you. Hey, buddy, you miss me?
Yeah, man.
Chief Edwards, definitely one of my favorites.
Such a good egg.
Yeah, I like her.
Yeah.
Good interview, huh?
Yeah, man. She's got energy, too. I like it. Energy!
We have more lights because it's not sunny enough outside.
Well, we're under a 10. What are you going to do? So, all right. So where are we at in terms of the competition right now? What are we looking at here?
So I know Hemi's going to try to walk over with the groups to go look at the BLS bleeding control.
Okay.
Stop the bleed.
Cool.
So
cool.
we're working that out so we can see some of that, see what other skills that our crews are trained in, right? You have tourniquet applications, you have pressure bandages, combat gauze, things that we were talking about before, right?
Right.
So that's things that they're going to walk around and take a look at for us.
Very cool.
But as of right now, we have a team that's looks like they're preparing their patient to place them on a reef sleeve.
And what you see right now is exactly the hardest part about competing. The fact that you have 3 other EMTs literally staring at you as you're doing your skill. So
no pressure.
It's no pressure. You're only being judged by your peers. No problem whatsoever.
Because we don't judge each other, do we?
Nope, not at all. People on the stream probably judging us right now. That's totally fine.
We love you anyway. Shout out to the stream. People who are watching, thank you for watching.
We appreciate
Thank you for the comments.
So yeah, with the stream going on, we got, as you can see, they're doing CPR. They're doing their thing, trying to manage patients as best they possibly can. And again, we've been harping on it this whole stream. Strong compressions are what you really need. Push hard, push fast, allow for full chest recoil. That's what you really need to do.
As you can see, you have minimal interruptions in between the compressions as well, too.
Oh yeah, definitely.
I think that we generally try to practice less than 10 seconds, but honestly, the actual answer is as least amount of interruptions as possible.
Yeah, 100%. Yeah. So, again, we have the other scenarios that are a little bit out of range and a little bit more blocked that we can't see it, but we do have the WMD scenario. We have the RTF scenario. Shout out to the guys from CTTF for coming down and helping us with that scenario as well. And then we also have the 2 patient care scenarios. Both of those are just trauma-based, and it just shows you about how fast we have to do this job and efficiently, because you can't just run. We were talking about that earlier in the beginning of the stream, where running is not the way we do things, because you just lose so much when you try to hurry in that way. You got to be controlled. You can be fast, but you have to be controlled when you're doing those kind of things. So
yeah, I mean, again, I know it's getting redundant and it's getting cliche at this point, but slow is smooth, smooth is fast. I mean, that's something that, again, when I trained in the military, that was ingrained in us. It was train as you fight, and the slow is smooth, smooth is fast.
Yep.
And so, there you go.
Their cardiac monitor.
Showcasing our life back.
Yeah, look at them go. All right.
So right now they're just trying to. They brought the life pack over. They're probably going to connect it on over to the patient, as my counterpart Captain Randy Lee was alluded to before. We're taking EKGs on the patients. They're probably going to put it on, see if there's any kind of cardiac activity with the patient there. But again, as you can tell, they're swapping out. They're alternating who's doing compressions because, again, more than 2 minutes, it's been shown that fatigue does set in and the level of compressions actually does go down. No matter how fit you may think you are, and this is where like an officer will definitely come into play because you have members who they'll just go for 20 minutes straight.
100%.
The pride is there. They don't want to stop. But as that officer, you need to stop them. Hey, we need to rotate. Let's swap guys or whatever.
Mm-hmm.
It's just better outcomes for the patient. And it's better for your crews as well, too.
Oh, yeah, for longevity and just to keep you being able to do those skills. That's exactly what it's for. Oh, shout out from the chat. We got someone from France in the chat. Shout out to France.
Hey,
fantastic. Awesome.
I mean, we've done it with each other, right? There's been times that we have to tap each other on the shoulder and say, hey, Randy, it's time for you to check out, brother. Like, I'll take over. You do something else,
Yeah, and we kind of harped on this a little bit earlier. It's really important to zero in with your partner because, a lot of times when you're on scene, on, the regular job, it's just you and your partner. You're really doing, treatment together, unspoken stuff together, getting the job done, and, that unspoken communication is really, really important. And obviously a spoken communication too, but once you work with somebody for a really long time, I can almost predict what he was going to do. So,
I think our greatest communication was nonverbal, in my opinion. We were able to just see what step the other person was on and just immediately just jump in or have that piece of equipment waiting for him when it was time to be used, right?
Mm-hmm. And you can see that with some of these teams also, they kind of just give each other that knowing glance of you got to do the next thing, and they know each other's mentality, and they're gonna do the next thing.
Yeah.
So.
As you said, shout out to friends, Pixu. Thank you for tuning in. Shout out to Tanisha, Farah. Thank you so much, guys. Thank you. You got people tuning in from all over the world and everything like that. We truly, truly appreciate you guys. Thank you for tuning in.
Yeah, it's fantastic stuff. So going back to the stream right now, we got paramedic Ribolito. Looks like they're managing that cardiac arrest, and that must be Division 8. They're over there, running away, doing their thing.
And I want to say I saw a paramedic patch on their jacket, so we should be expecting some form of
they're already
intubation
intubated.
happening. Oh, awesome.
Yep. We can see that going on right now.
Oh,
the
yeah,
patient is
I see it.
intubated.
Awesome. Again, communication is key in these situations, right? It's just for better outcomes of the patient, communication is just huge on this.
And as you can see, they're going to be moving the patient. Oh.
Utilizing the Reeve sleeve. One of the many carrying devices that we have in the fire department and what we have on the ambulance.
And you can hear that cheering behind us.
Oh, I love it. I love all the energy and all the screaming and everything that's going on. It's amazing.
Our co-host Hemi Prasad is over there cheering when he should be working.
That's kind of what happens when you're on break 90% of the stream, right?
Well,
you have all the energy to do that.
We're going to have to get him later for that, right?
Oh, listen, this guy's buying later.
We'll get him to interview Division 8 later, hopefully. But yeah, we got the teams going through that. Oh, they're going through the tunnel now. So Division 8 team's actually comprised of 2 rescue medics. We got Mustafa and Shwayne George over there doing their thing with paramedic Ribolito. So we'll see how they handle the box. Oh.
And as you can see, they actually have their Shwayne has on his bunker gear.
Yes, he does.
Which I feel bad for him because I know I'm sweating for him at this moment.
It is super hot in that gear.
But respect and shout out to him. It's what he trains with all the time. It's what he's comfortable with, and it's what he decided he wanted to compete with as well.
100%.
So shout out to Shwayne and the Stock and Rescue Department. Shwayne looks like he's getting a visual right now, sticking his head in, checking out his partner's progress. And his partner's coming through, who's also in his bunker gear.
Looks like he made it
Shwayne's going through. Shwayne has decided to go in head first. That's how I used to like to go down the slide as a kid as well, too.
Oh, yeah.
Head first,
And he's making it through. Oh, the bag went through first.
Okay, he got it. And Shwayne is through. Shout out to Shwayne. His headlamp is kind of hanging up the side of his helmet, though.
Yep, they're going to make fun of him for that later.
Oh, yeah, I'm going to make fun of him right now. He's got his goggles on the side of his ear. But I love Shwayne.
Go Shwayne. One of our fine rescue medics from the SOC battalion. So.
Yeah, no, one of the best that we have. And you can see from here, we have Mustafa that's currently doing compressions right now. I'm assuming they're going to be getting their Lucas device situated. Yep.
Yeah, they're really making moves on that one. So for a recap, just to let you guys know how the competition works for this obstacle course that you're currently viewing on screen, the members come out of the ambulance and they're supposed to don their PPE, depending on which one they feel more comfortable with. Our rescue medics generally feel more comfortable in their fire turnout gear because that's the one they wear the most, so they're comfortable in putting that stuff on. And then our paramedics are usually wearing their standard USAR-rated bunker gear. What happens is they go through the course to a certain degree and they will find a patient in cardiac arrest. They will manage that patient. From an ALS perspective, they're going to intubate the patient, get IV access, and drop their first-line medication, which is epinephrine. And then they're told that they have ROSC on the patient, meaning they have pulses back. That patient will then be transported. As they're going through the course, there's a couple of little things, injects, if you will, that will basically stunt a little bit of their progress there. So some of them are low angle, and as you saw, they're going through that tunnel. And after they get through that tunnel, they're allowed to start utilizing that Lucas device that we've been talking about all stream.
Yeah, I mean, and most importantly, going through all these obstacle courses and everything, is the continuity of care, right? At no point do they not have any form of hands on the patient, right? They're continuously working on the patient, they're continuously carrying their gear. Right now, they're securing down the arms and everything because they don't want those flailing around. I mean, real world is the same thing. The arms would be secured to the side of the device. Unfortunately, the mannequins kind of make it a little bit hard to do that because it's just not as flexible in the arms and everything. But as of right now, they decided to use these stretcher seat belts to hold the arms in, which is a great idea. And they made the mannequins say hi to everybody as they're walking through.
As they do.
Ventilating. And for those seeing that, no one's doing compressions, the device is simulating that it's on right now. But it's, as my partner has already said, it's not rated for the mannequins. It could actually destroy the mannequins, so they're allowing them not to have it on.
And currently on the stream, what you guys are watching is the BLS team doing the same scenario. As you can tell right now, the equipment's slightly different. They're utilizing that AED. They have ROSC right now, and they're going through the course as well. And you can see right on the screen right there, that is the Lucas device. That's the case it comes in. When you put it on as a backpack, it kind of makes you look like a Ninja Turtle. Kind of cool. Kind of fun.
I'm more of a Michelangelo fan. How about you?
I'm a Leonardo fan.
Hey, that checks. You know what? I would have thought you'd have been Donatello.
Oh, because he's like kind of nerdy?
Because you're kind of nerdy.
That's cool.
Yeah, you're more like the statistician kind of guy.
You know why? Because I like blue and I like the swords thing.
Oh, okay.
It confused me why someone would fight with a stick, but...
I always thought the nunchucks and pizza was my thing.
Yeah, that I understand.
I mean, it's New York. You can't go wrong with
Well, it's EMS Week. There's a lot of pizza parties going on, so it's going to be a good time.
That's true. So shout out to our cameraman who just walked by, Nelson. Just walked by.
Nelson! So, much love to Nelson.
Yeah, how you doing? So
again, we're here at Fort Totten for the 2026 EMS Week Competition. We have a lot of competition things going on right now, a lot of scenarios happening right behind us. We are going to slightly talk a little bit more about the RTF scenario because we didn't really touch on that too much. So in that scenario, I believe, I'm not 100% sure, I think it's either an office space or a school, and they have multiple patients post some sort of gun violence, right? So the teams are going in, they're wearing their RTF vests. So it's a little bit different than the standard vest that we all carry on the ambulance. This one's specifically for this type of scenario. So they're going in there and they're triaging all the patients. Triage in that kind of scenario is different from start triage that some people might be more used to. So in that kind of situation, there's not like the standard green, yellow, red, black tag. It's going to be more of the alive, red tag, black tag. So the situation is slightly different. Triaging is done slightly differently just to help facilitate patient care in that kind of environment. Also, the main difference in that situation is that you're going to have some force protection. Yes. And you're going to have SRG with our members, including fire.
And PD really spearheads this
one. PD does,
for safety
really,
reasons, obvious.
They're really in charge of those scenarios, and, we follow their lead because they're protecting us and we're there to protect the patients. So, it's a very conglomerate, it's a mixed-up effort, right, between all of us.
Yeah, I think this is a very resource-heavy sort of situation, right? Because you have ourselves, you have the firefighters, and you have the police all working together. Same goal, same common goal.
Right. And also extracting the patients a little bit different than it is in most of the scenarios you see on screen or the stuff that we've been talking about all day. So usually how it works is that you're going to treat all those major injuries bleeds, like arterial bleeds especially, where you're going to put on that tourniquet. Maybe you're going to put on a chest seal, and sometimes you might even needle decompress. I don't know. It depends on the situation. Probably not.
Yeah, just emergent treatment.
Yeah, just the emergency
just things to keep you alive so we can get you to a safer environment, right? That's really the biggest thing, is getting you into a safer environment.
100%, yeah. And that is a very big conglomerate effort between Fire, EMS, and NYPD, where all three agencies are working together in that environment to do the best in that kind of situation. So, but to go back on the screen right now, we do have a cardiac arrest management happening from our EMTs. As you can kind of see right now, the CPR is going on. What you probably can't see is that back of that EMT right there. He's probably ventilating the patient, right? Let's go through a little bit between ventilations versus intubation, right?
Okay, so with respiration, there's like more than one thing, right? You have the cellular level, you have the mechanical level, basically, right? So you have to be able to actually push the air in, if I'm using layman's terms. Now, ventilation alone is okay up until a certain point, right? So for the folks out there, you do have two tubes. You do have your breathing tube and you have your feeding tube, is what I'll say.
There you go, yeah.
Right? So if you're just using just the ventilator, just bag valve mask, essentially you're going to be pushing air into your stomach as well, too.
Right.
And, you know, for those that you push too much air into the stomach, eventually that air is going to want to come back up. And it's going to come back up with whatever's in the stomach. Right? And that right there just brings up a whole slew of other issues and complications for patients that we just necessarily can't afford. Right? This could be life-threatening situations, situations, and you know, things that we want to avoid. Which is why the intubation is probably like our main course, right? Because we want to block off that other tube and have to avoid any issues with that.
Yeah, so that's one of the main differences that you're going to notice between the BLS teams and the ALS teams. The BLS teams are going to be utilizing the ambu bag, the BBM, to ventilate the patient, and then the paramedics are going to be intubating the patient, making that definitive airway. On top of that, the paramedics are establishing intravenous access to get the first-line medication in a cardiac arrest, which is epinephrine. So, as we're going back to the screen right now to take a look, we have the BLS over there. It looks like they're getting ready to transport the patient. I think that's the Lucas device. And it looks like they're going to get ready to start transporting that patient soon. You know, it's funny. I'm watching this team go right now, and I'm watching that last member grab the bag. And that's one of those things, I don't know why, like sometimes you take that for granted that there's a bag there and you got to pick it up or whatever it is, but in
I know we always made someone in charge of that, right?
Yeah.
Do a last minute sweep, just look around.
And I know as an officer, when I was on scene, I would always say, I got the bag, don't worry about the bag, because that's one less thing you have to worry about. But in teams of 3, you know, that third member is going to be in charge of carrying that bag. You know, you don't want to leave anything behind. You want to make sure you have a clean scene when you leave also. So,
you know, I'm glad you said that. I'm glad you brought up officer as well too, because you know, like we need the officers to act as an extra set of hands, right? Especially in the real world, and things like this is going. You kind of want your members to be treating the patient. Right. So if they leave behind equipment as the officer, you should be the one doing the last minute scene survey, walking around and grabbing anything that may have been left behind and bring it along to the hospital with them.
100%. And on occasion, it may happen they might leave it like something behind, but we'll always go and get it back, because that does happen on occasion. Because some of these scenes are quite chaotic, and the priority is not to then take your equipment. It's the priority is to make sure that you get the patient to the hospital.
Right.
So it does happen on occasion. I know a few times I've had to go back on scene because we may have left something. I don't even know. But.
Yeah, and you know, people understand like it is important because we potentially need it for the next patient, right? Like emergency just don't stop just like that. They're just ever evolving. 24 hours a day, this city doesn't sleep. So there's just constant emergencies going on day in and day out. You know, I think lately we've been averaging more than 5,000-6,000 calls a day.
Yeah.
Which honestly, that's more calls than some systems handle in a year. We do that in a day.
This is very true.
You know, our city, 9.5 million people is easily.
Yeah, and you know, referring to the chat right now, they're doing such a good job, quote unquote. The skills shown here, not just anyone can perform. This is true.
It's true.
It takes a lot of training. It takes a lot of reps. It takes a lot of just that personal goal of just being able to treat people well. And you know, as we can see from the teams on the screen, everyone's just trying to do their best to help. And
yeah, I mean, this is why we do, you know, annual, semi-annual, you know, trainings, right? This is why we come back every couple of years and do a full refresher.
Right.
We come here with the instructors, with doctors.
Right.
You know, as medics, we have to do this quarterly as well too, right? We have to have this continuing medical.
And then we
education.
also have the BOT updates. So the Academy always pushes out updates because medicine is ever changing, right? you'll always hear this, medicine is a practice, not a science, because stuff changes all the time. Nothing is locked in stone, and the more we learn about the human body and what functions with it, medicine will change to accommodate those changes, right?
Yeah, changes all the time. Medicine changes all the time. What's old is new again sometimes, right?
Yeah.
I know when I started 20 years ago, we combated cardiac arrest on our own. Then they added officers. We had multiple medications. They changed medications. I mean, like medicine is just, ever evolving. And one of our instructor
As
staff
he
just
walked
walks
by our screen.
I'll get him later.
Yeah, that's all right. We'll get him. I remember when I first came on, tourniquets were out of protocol.
Yes.
You remember that?
Yes.
Yeah, and it's funny.
Now it's become like a huge go-to, like
right.
nationwide, really. I mean,
100%.
It's one of those because, and putting it on properly, that has to be like stressed. That has to extremely be stressed.
Yeah.
That tourniquets should be put on by trained professionals. I understand some folks, they see things on TV, they want to use a belt, they want to use a shirt, they want to use a towel. I gotta stress to you guys that the TV is just not real life.
Yeah, and just recognizing the need of a use of a tourniquet is a big deal. We'll take it to like the Boston Marathon, right? So during that incident, there was a lot of lay people, nurses who were actually in the crowd and stuff like that. They put tourniquets on people really, really quickly. That saved a lot of lives.
Yes, absolutely.
Just recognizing that you need to put that stuff on, the tourniquet on, it's going to make a big deal, right? A lot of times in our world in EMS, recognition of an issue and acting upon it quickly is huge. Especially in the cardiac arrest scenarios. We kind of spoke about this earlier about the second chance ceremony. A lot of those situations where you have positive outcomes was because someone recognized there was a problem, activated the 911 system, and then they themselves started acting to save that patient. It's a big deal, and current guidelines talk about it. In the chain of survival, after you call 911, immediately beginning care on that patient is paramount. And we see it from second chance ceremony that it really does make a difference.
Yeah, and one of the things too that I don't think it's harped around too much is proper documentation, right?
Yeah.
Having actual notifications, right? Because being able to come into the hospital and give that oncoming doctor, that receiving provider, a good history, a good medical history, a good presentation, good scenario, because they don't get to see the patient in their initial emergency, right? We see them at their first emergency, so they may get them once there's already a tourniquet in place, right? Once we've already given them fluid resuscitation, once we've already helped with their blood pressure, they see them afterwards, right? Or sometimes we have the monitor where we have to, electrically manage somebody, right?
Yeah.
Whether we cardiovert someone, we restart their heart, or whatever the case may be, the hospital staff are getting these patients afterwards. So getting our initial report from EMS from the field is paramount. It's part of the continuity of care that we were speaking about.
And it's a big deal that that people start recognizing these things early so they can start acting on it to help people out there. So if you are interested in doing some CPR classes, we implore you, take one. You can also go to FDNY Smart, and there you can basically set yourself up for classes if you're having a street fair or having something at a school. Our CPR unit will come out there and help you. Also, in terms of fire safety, we have that at FDNY Smart as well. So go to FDNY Smart. You can take a look at that stuff and educate yourself a little bit on those things, and you can potentially save a life.
Also, get to know your local firehouses and EMS stations in your community.
Yeah, come by, visit.
A lot of times, come by and we will sit with you and we will show you things. We will show you what it is that we do. We will show you our ambulances. We'll show you the firefighters will show you their rigs and everything like that. A lot of times we have like the neighborhood block parties. We'll have the CPR units come by. They'll have the mannequins, and you yourself can practice these things and can learn different skills that we do that can help before we EMS the professionals get there on scene.
Right. Yeah, and during the summer we have those block parties, which is a great way to interact with your local first responder. So if you go to Join FDNY or FDNY Smart or the FDNY web pages and visit the socials, go to Facebook, go to YouTube, go to Instagram, you will learn about those events. Come by, hang out with us. It'll be a great time.
Yeah. So moving on, what do you see on the screen there? What do we got going?
So we have the WMD scenario. It looks like they just wrapped up over there. They're doing some cleanup. It looks like. Yes, because there's a child.
Yeah, I mean this is a long, exhausting day. So we definitely have to give the teams breaks in between. They have to make sure they hydrate, make sure they get some food in.
Well, not just the teams. You can also look at like the
staff
staff
as
who's
well.
here working
Yeah,
on that
absolutely.
stuff, right? It's huge. It's a lot of work.
Absolutely.
Again, shout out to them because they've been here since 6 in the morning, and they've been just working, just to make this event run as smooth as it is right now. And that's what they've been driving it around in.
Our gators.
Our gators.
Yes. We've driven a couple of those. I think we put them on 2 wheels a couple times.
Unofficially.
Allegedly.
But we're going to go take a break right now. We'll be back right after this. Thanks.
Thank you.
So now it's just waiting for the first responders to show up, right? But you've controlled the bleeding, okay?
She's still bleeding. Okay. As tight as possible. Pull it. Push yourself against the wall. Direct pressure.
All right, so we're live with Division 4. We're going to ask these guys, how's the day going? They seem a little drained. How you guys feeling?
Feeling pretty good. Tired. But good. Yeah, it's hot. Yeah.
It's definitely hot.
Good.
How was the scenario, guys, for you guys?
Scenarios are awesome. They did a phenomenal job setting the stage for us, and we got to work some real hands-on stuff that we could do out there.
Very nice. How about my medics? Guys, how we feeling?
Great work. It was a fun time. Always fun to be outside and just show our work and show what we do. And it was a wonderful time. I had a good time. Yes!
Probably.
I'm going to be fourth, though. I'm too old to go through tunnels. I'm too old for all of that, yeah.
You're going to coach next year.
Coach. Those who can't do, coach. So, coach.
All right, and it's EMS week. What's the message that you guys got for everybody?
I do have one. Hold on.
Trust your
No.
coworkers. Yeah.
Family. Take care of yourselves and take care of your coworkers. That's all that matters. And don't worry about what the Chiefs. It's not the Chiefs' event. It belongs to the members and members only. So doesn't matter if your captain is mean or whatever. This is your day. This is our week. No matter what.
Make the most of it.
All right, then. All right. Well, Randy, you heard it. We're going to send it back to you, my man.
For that. All right, so we're just about to the last round of the competitors. It's been a long day for them.
Long day, buddy.
Yeah.
And the sun is just getting brighter. It's just getting hotter out here. A beautiful day, though. I mean, clear skies.
Yeah.
Could we ask for a better day?
I do not envy them being in their turnout gear.
Oh, man. I think I purposely left mine in the trunk of my car. I don't want to even look at that thing right now.
Yeah. But they're out here. They're competing. They're putting on that turnout gear. They're going through scenarios. Again, welcome to Fort Totten for the 2026 EMS Week Competition. My name is Captain Randy Lee.
Captain Jonathan Rivera.
And we're happy you guys are here joining us. So,
day one of EMS Week. What a way to kick it off, huh?
Of EMS Week. Yeah, pretty wild, right?
It's crazy.
Yeah, there's a lot of really cool events that are going to be going on throughout the city from your EMS station. So take a look on any FDNY socials. Take a look and see if something you can hang out with your local first responders. We'd be happy to have you.
Yeah, I mean, if anyone listening in or looking out, civilians or whatever, they're interested in becoming EMTs, where is it we can send them to?
So go to Join FDNY, and if you want some more information in regards to that, we do have the Join FDNY podcast, which I host. Selfless plug for myself, but do check out the Join FDNY podcast, because if you're interested in joining the fire or EMS sides, we have all the information on there. Captain Brown is on there, Andrew Brown, and he's one of my co-hosts over there. We go through all the ins and outs. We interview a lot of people on this job, and a lot of them are from the Academy, so we can give you really good insight on what you need to do, how you can prepare to join this amazing department.
I know we also have the youth program, right?
We do also have the
high
youth
school
program. Yep. So we have the youth program, we have the cadet program, multiple programs by which you can really start getting involved if you want to become a firefighter or EMS person on this job. So take a look out for those things. They're always posted up on FDNY socials, especially those DCAS exams. So take a look at those things because we would love to have you if you want to be with us. So where are we at right now?
So, moving on. So, it looks like right now we're still kind of like in a period of reset. I know a lot of the teams are kind of over by the spirit tables and everything like that, and I think they're kind of game planning for the... We have people just game planning, for the last group of go-arounds.
Yeah, if you can see on the stream, you have a couple of the teams running around, and they have two people with them. That's going to be the BLS coordinator and ALS coordinator. They're
important jobs. Very, very important jobs.
Important jobs, right? So from an operations perspective, their job is really to make sure that the BLS and ALS are getting the training they need, and they're learning what they need to learn. And also staying on top of their internships when they're new.
Yes.
Right? ALS coordinators are really, really important in that they help us kind of organize to get ready for our CME credits. As paramedics, we have to maintain a certain amount of CME credits to maintain our certification. So ALS coordinators, God bless you.
I mean, they keep us operationally ready, right?
They really do. They really do.
These are things that we don't really look at all the time because, our day can kind of get repetitive, right? You come in, you sign for your equipment, you sign for your radio and everything like that, and you just immediately, from the moment you log on, you're getting an assignment. I mean, that's just how busy it's been lately. The call volume is only getting worse, and it's just the way it is. As soon as you start, you're going to work immediately.
Yeah.
So having these coordinators to do the ancillary things for us, I mean, it's amazing.
It's really, really important. And with the inclusion of the BLS coordinator, which happened a number of years ago, it's been great because now the BLS have a coordinator they can go to, and especially the interns, when they're first coming out, there's a lot of questions they have. And yeah, they have their partner, but it's nice to have multiple resources, right? Sometimes they come to the lieutenants and officers, captains of their station, but sometimes they feel a little more comfortable going to the BLS coordinator because that's the point person.
It's more like their same level and everything like that. They kind of get to see their progress, judgment-free, everything like that, and actually get some training involved with it, right? It's a little extra acting like we were talking about before.
Yeah, and definitely a shout out to where'd she go? Oh, I thought she was behind us. Captain Gurgenti. Anne-Marie Gurgenti is the captain of all the coordinators. She really helps manage them, work. And she is really busy today. We were going to try to catch her earlier, but she literally just ran off. So But shout out to her, definitely. Captain Gurgency does a lot of work with the coordinators, and Nikki also. They do a lot of really, really good work. They're just out there constantly making sure that we're restocked on what we need so we can help you, the New York City public. So thank you to them. So as of right now, like I said, the last group of competitors are gearing up to go and do their last rounds. That's going to be Division 9, Division 3, and Division 6, respectively. That's going to be Queens. Wait. Did I say it right? Yeah, Queens, Brooklyn, and then Manhattan North. So they're going to be out here. They're going to be competing. We'll bring that to you once they get onto the field.
It's a nice way to round about the day, right? Not too
Yeah.
bad.
Not bad. So again, we've been out here. Our teams have been out here competing since about 8 o'clock, 8:30 in the morning. Started with a Cahoots exam, which is basically a Jeopardy-based kind of exam where they're just going knowledge for knowledge against all the other teams that are here. After that, they came out to this course where we had 4 different kinds of scenarios for them. We had an obstacle course that has a cardiac arrest component. We had an RTFs and WMD scenario. And then we also had 2 patient care scenarios. One was a stabbing, and the other was a pet struck.
Pet struck. A bicyclist that was struck, correct.
Right. So again, the main points of these things were to make sure they had expedient care and then expedient transport, which was a little bit different this year. I noticed that there is this KDT component. So the MDT or the KDT is something we have in all of our ambulances that basically dispatches us our jobs. It gives a little description, location, and then also it allows us to
Kind of get like a brief summary, a brief history of what it is that they're walking into.
Right, yeah, and it basically, it relays back to our dispatch centers so they know what we're doing, where we are. There's GPS attached to it and everything. And then when we go to the hospitals, depending on where we're going and stuff, it helps give them a little bit of a heads up that we're heading towards them. So especially we have a note, which a lot of these situations would call for. A note basically means that we're contacting the hospital and letting them know, hey, we are X amount of minutes out. We have this kind of patient. Please be prepared. Usually,
we're giving them a heads up.
Yeah, 100%. And how many times have we gone to the hospital, called a note, and they're waiting for us outside?
Yeah, they're waiting
That's
outside in the
what
parking
you
lot,
want.
ready to grab the patient. I mean,
100%.
there it is.
Yeah, and that's the way it's supposed to be, right? We render the care as best we can, as fast as we can, to get them to the hospital. Then the hospital takes them from us as fast as they can to render care as fast as they can. That's how you get the best patient outcomes. So.
Yeah, the continuity care. This is where, like, you, the callers, either for yourself or your loved ones, is super important to tell us exactly what it is that's going on. And the questions that are being asked of you is purposeful. We need to properly, send out the proper resources for you guys. So this is why we ask certain questions that we ask.
Yeah. And, if you have an emergency, that's why you call 911, because we will be there for you, along with NYPD and the fire suppression units. So just to give a little shout out to the other side of that, we also have our fire inspectors, because there's no fire inspector scenario, but we have to shout them out as well. But, when you run into a situation where maybe your building's not up to code, the fire inspectors can go out there and make sure that you're, compliant, so you won't run into fire problems. But yeah, as right now, teams haven't come out yet. I'm wondering if, and misjudged it, maybe the last teams were already done. I'm not sure. No, I'm pretty sure we have one more group of teams that are supposed to come through.
I think they're just kind of like getting their things together as we speak.
Okay.
They still see the instructor stats and all their prospective
Gotcha.
locations and scenarios. But there goes one of the bosses.
Bosses everywhere. They're floating around.
But yeah, all right. So, just to break down.
Yeah, we apologize a little bit because this is a live stream and people walking all around us. And some of them are either waving at us and we're not sure if they're waving at us. And some of them were waving at people behind us and we thought they were waving at
Walking
us.
past cameras.
But
why don't you give a quick recap from the beginning of the day till now? Like what it is that people got to see on the stream.
Thought I just did that.
Nope.
No, did I not? So let me give you a rundown how this all worked. So as of yesterday, we had the academy staff as well as some division staff over here setting up the courses, setting up the scenario for our competitors. Starting bright and early, 6 o'clock in the morning, all of us got here to set up the tables, set up the spirit tables, and then we had ceremony over here setting up the sound system. We had digital media from OPI over here setting up this live stream for us. It's been a very long couple of days, and this is all in support of EMS Week, which is what we are celebrating. So we have families here, we have membership here, we have leadership here, and it's all to celebrate EMS members on this fine day. So What do we got in chat?
Yeah, and again, this is something that the planning, literally, like this, when this is done today, I'd say by next week, few weeks, they're already planning for 2027. That's just how big of an event this actually is.
Yeah, and it is legitimately a celebration for EMS workers, right? And we want to do the best we possibly can for our EMS employees. And as we are EMS employees too, we enjoy it. We have a good time with this. So,
shout out Brett Fields, Aaron, Tejada. Shout out to everybody that's messaging.
And correction, that was the last of the competitors. The competition is now done.
Wow.
Unless they're going to do some of those side scenarios over there. But as far as we know, the way they're looking, they're trying to pack up and get ready for the medal ceremony, which we will bring to you live, but we will shut down the stream first and set up another one. So stay tuned for that. Yeah. So this is the point where they're going to start doing some stuff for the spirit tables. They're going to go out there and judge them. So again, how the spirit tables work is improving outcomes together is the motto of EMS Week for 2026. And this is a nationwide thing. This is not just here in New York. So we have the Chiefs going out there. They're going to look at the tables from each division, and they all had their spin on what that meant to them. So some people had photos of their membership. Some people kind of made it look like you ever played the game of life.
They drew,
Yeah, so it looks like that. They had the cardboard cutouts and stuff like that. It's really cool. There's a lot of balloons. And we saw Division 6's balloon fly away, so that's sad for them.
So I got to say, like, you and I have done a lot of competitions, right? We've been competing for a decade each, most likely, myself. Like, have you ever seen one as big as this?
Not really. I mean, maybe some of the international competitions because they're covering such a larger space. But I mean, you're
Those
talking
are usually attached to like conferences and stuff like that. I mean, like something where we're literally taking a whole parade field and actually like making an entire like family day event.
And this is a large amount of teams. The logistics behind all this stuff is pretty huge. And we had brought in some of the leadership involved in that. And the planning does take a very long time. And then the resources from the EMS Academy plus the ceremonial unit and all, and of course the support from the FDNY Foundation is really what makes this event so possible. So again, thank you to all of them. It's great to see when you have the families come out here and they get to cheer on, their family member or the divisions to cheer on potentially their partner. So it's great to see. It's really, really cool.
Yeah, I'm glad that this is something that's been going on for over 20 years, and I'm just glad that we've kept with it. At this point, tradition and legacy is something that's super important.
Yeah, and again, originally when we were competing, this competition was held at headquarters in Brooklyn. And while the competition was amazing, it was super fun for us. There was this little bit of a disconnect where we couldn't have our families really like view it. It was a much more chaotic scene. It was very Universal Studios. Really cool from a competitor standpoint,
but not as large of a scale of operation that we currently have right now.
Yeah, this is definitely bigger, and this is just the advancements that we're putting out there to get back to our membership. So it's really cool. I'm kind of jealous that we don't get to compete in this stuff because we don't compete locally anymore. But it's cool.
No, we're the old guys now.
We are the old guys.
I think it's time for the younger generation to kind of like take over for us.
For sure. All right. So we're gonna pivot over for a moment here. We're gonna take out Captain Rivera. Alrighty. And we're gonna bring in Lieutenant Prasad. How you doing, Lieutenant?
I'm doing pretty good.
How was it out there?
It's hot. It's
hot?
definitely hot. Yeah, but it's a beautiful day. The crews that are coming together. It's a lot of camaraderie.
How the team's doing?
They're doing pretty good. I'm seeing a lot of smiles, and then I saw a couple of frown faces, but everybody's keeping their chins up high.
What's the general consensus for the teams right now? They're all feeling pretty confident?
Everybody's feeling pretty confident right now.
Okay. I'm putting you on the spot now. Who do you think's going to win?
Who do I think is going to win? I don't know. Based on the crowd, it sounds like the Bronx came pretty heavy, so I'm thinking maybe the Bronx might take at least one of them out.
Incorrect. The answer is Division 8. Only because we work for Division 8.
It's absolutely going to be Division 8 for sure. I had to be, unbiased.
Yeah. I'm biased. No, I'm kidding. I have much love for the Bronx because that's where I worked for a long time. Much love for Brooklyn because that's where I work right now. Yep. Queens, Manhattan, Staten Island, we appreciate you. But no. Just kidding. I'm just kidding. But no, all the competitors out there are really crushing it. We got to watch it all day on the stream, obviously. And, they're putting it out there. They're really going for it.
Yeah, they really are. These teams are leaving everything out onto the field. They're just ready to wrap up the day, and they're ready for being placed right now. So let's hope, Brooklyn North, we land really heavy on there.
Yeah. Did you get a chance to see the spear tables while you're walking around?
I did not, unfortunately.
Oh, okay. So Captain Rivera and I were trashing on you just a little bit, right? Because we were like, we're gonna cut to Lieutenant Prasad, and we saw you sitting over there. But then I saw you cheering for Division 8. I was like, that's forgivable. That's totally fine.
I mean, I have to go for Division 8, right?
But you didn't think they were gonna win?
Well, I'm trying to be unbiased. That's just the whole thing. I can't.
Well, you support your teams, right?
Yeah, of course.
Yeah.
Of course.
I hear you, of course. So, I mean, obviously they're wrapping up right now. They're starting to break down all the scenarios.
Yep.
They're going to start doing the tallying. Now, I know you've been involved in EMS Week Competition in the past.
Yes, I have.
Now, what's scoring like?
Scoring is...
Is that like chaos? I'm just imagining people with calculators running around.
Absolutely it is. It's quite intricate. It's a formula where a lot of instructors have come up with different types of judging. And for this year, I know Stanley Cole, that works over here at BOT, had a big part of it. And an entire committee. So these guys say, it takes a lot to put this day together.
Yeah, and I mean, it shows. I mean, it ran really smoothly. It looks like the teams really got something out of it. I mean, the families look like they're having a great time.
The families definitely had a great time. It's a great show. So it's a big turnout, so we couldn't be any more happy.
All right, fantastic. So we're going to take a really short break. We'll be right back. Thanks.
Last thing I remember, I'm not laying in the bed with the phone like this. She said she just heard the phone fall. I fell off the bed.
He just held his head up, looked at me this way, and he just passed out. He was not breathing, and I knew right then that I needed to perform CPR to get his heart pumping. I directed the kids to call 911, and I also asked them to help me move him because he was not in a position where I could turn him over onto his back to start CPR. I continued, and then the 911 operator said, just keep doing what you're doing. Just keep doing CPR. To the first responders, I am tremendously grateful. I started it, but there was help. Thank God there was help.
She was the first of the first responders. That's why I'm here today. Yep, she... I don't know what to say. I'm so thankful. Without her that night, I wouldn't be here for sure. She gave me a second chance in life.
I was CPR trained about 9 years ago, and when this incident happened, it all came back to me. I remembered everything, every step. I do believe it's important to learn CPR. Every minute counts, every second counts. You never know when you're going to be in the situation where you need to help somebody. You never know when you need to save a loved one.
So now it's just waiting for the first responders to show up, right? But you've controlled the bleeding, okay?
She's still bleeding. Okay. As tight as possible. Pull it. Push yourself against the wall. Leave the bandages off. Direct pressure. Tie it on the wound.
last thing I remember, I'm not laying in the bed with the phone like this. She said she just heard the phone fall. I fell off the bed.
He just held his head up, looked at me this way, and he just passed out. He was not breathing, and I knew right then that I needed to perform CPR to get his heart pumping. I directed the kids to call 911, and I also asked them to help me move him because he was not in a position where I could turn him over onto his back to start CPR. I continued, and then the 911 operator said, just keep doing what you're doing. Just keep doing CPR. To the first responders, I am tremendously grateful. I started it, but there was help. Thank God there was help.
She was the first of the first responders. That's why I'm here today. Yep, she... I don't know what to say. I'm so thankful. Without her that night, I wouldn't be here for sure. She gave me a second chance in life.
I was CPR trained about 9 years ago, and when this incident happened, it all came back to me. I remembered everything, every step. I do believe it's important to learn CPR. Every minute counts, every second counts. You never know when you're going to be in the situation where you need to help somebody. You never know when you need to save a loved one.
So now it's just waiting for the first responders to show up, right? But you've controlled the bleeding, okay?
She's still bleeding. Okay. As tight as possible. Pull it. Push yourself against the wall. Direct pressure. Tie it on the wound.
Welcome back to Fort Totten. My name is Captain Randy Lee. I'm going to give you a recap of the day. So, we are here at Fort Totten celebrating 2026 EMS Week. We're here for the EMS Week Competition. Currently, they're in judging phase right now. So, here's what happened. So, we started around, I want to say 8:30. Teams from across all the boroughs came over here to compete. 8:30 was the start of the testing phase, you could say. It's the cahoots thing. So, think of it like Jeopardy. So, you had all the teams sitting in a room, hitting little buttons, and they had to go knowledge against knowledge to see who was the smartest. So they're going to take that into account. After that, they came out to the field behind me. So we had 4 different scenarios going at the same time. We had RTF and WMD. We had 2 patient care scenarios as well as an obstacle course. So let's go through those. The one that you saw most on screen was going to be the obstacle course. So how it worked was our competitors got out of the ambulance and donned their turnout gear, and then they came upon a cardiac arrest. They had to mitigate that cardiac arrest by, depending if they're ALS or BLS, applying an AED. For medics, they had to intubate, they had to start IV access, give first-line medication, and then they were told they had ROSC. As they progressed through the rest of the course, there were certain obstacles in the way, some low-angle things, some stuff where they had to go through the tunnels, all this stuff to basically foster a better communication thing between them all. When they got to the end, or more towards the end, they had to use a Lucas device, which is a mechanical CPR device that would utilize to basically help do CPR when you're on the move. After that, they got into the ambulance and represented that they went to the hospital. Every scenario here was about 20 minutes from start to finish, from just the 2-minute prep time of giving the information of what they're going to be doing, all the way to the end. So everyone started around the same time, ended around the same time. That's the obstacle course. Next, we had the RTF scenario. RTF was basically a shooter situation where you had multiple patients. Our teams went in there and triaged them with RTF triage system, not your standard start triage, but they went in there and marked someone as alive, red tag or black tag. Of course, obviously, they had to mitigate whatever injuries were found on the patient. So sometimes they were using a tourniquet, sometimes they were using quick clot, sometimes they were using needle decompression and chest seals. So depending on what the patient called for, they utilized those things, and then they would not necessarily transport the patient, because it depends on the scenario of whether or not they transport a patient or they let another team in an RTF scenario. But that's basically how that went. WMD-wise, we had organophosphate poisoning with multiple patients representing signs of sludgem, AMS, and difficulty breathing. That basically warranted the use of duodotes, where they would basically take this medication of atropine and 2-PAM. They would inject it into the patient's thigh or wherever accessible, and from there, they either had to give 1, 2, or 3, or maybe none, depending on the patient presentation, and then in theory you would repeat that dosage up to a certain point. That's weight-based medication stuff, and from there they would represent that they transported the patient. The rules over there are a little bit different because it is a WMD situation requiring a class order from our doctors, but they were briefed upon that and they got that situation taken care of. Now, the patient care situation scenario, it was different for ALS and BLS. ALS, I believe, had the ped struck, so it was supposed to be a patient riding a bicycle, struck by a vehicle, and ended up with some different injuries and was unresponsive. For the BLS scenario, they had, I believe, a stabbing. I may have that backwards, I'm not sure, but, you know, we could always watch back. But from the BLS side, they had a stabbing, so they had multiple stab wounds. They had to mitigate those issues and then transport the patient. What was really important for both of those scenarios was that they were supposed to treat the patient on scene quickly, efficiently, and then... Hi, Doc. How are you? I'm on stream. You're... Okay, cool. Thanks, boss. See ya. Live streams. Fun times. So... I forgot where I was. Well, he didn't give me a class order, so I think we're okay. So, anyway, their job was basically to mitigate on scene, and then from that point, they're going to transport the patient. So there were actually bonus points for going 82 or going to the hospital at an efficient pace. A lot of this stuff, especially in trauma situations, it's more important to get your first-line treatments in and then transport. You really shouldn't be messing around on scene trying to do those extra ancillary things when it can be better handled at the hospital in the OR, something like that. So currently, all the teams have competed at this point. Judging is going on. We do have representation from every division here, so that's 1 through 9. That represents Manhattan, Queens, Brooklyn, the Bronx, and of course Staten Island, and EMD. So, big ups to all of them for representing, coming out here. We have many members from across all of the FDNY joining us today. We have a lot of leadership we were interviewing, and currently I think there's judging going on for the spirit tables, because on top of the competition, this is like a giant celebration as the start of EMS Week. So with the spirit tables out there, using the motto of this year's EMS Week, which is, what is the motto? I always forget this. Improving outcomes together. I wanted to make sure I said it right. So that's the motto. They all set up tables differently. It's just to represent a little bit of character, a little bit of flow for each of their own divisions. And they're going to get judged on, and we'll see who wins this year. I think last year was Division 8, and we'll see who wins this year. We also, you can kind of hear it on the far right side over there, we have the strongman competition. They are literally just pulling ambulances. I would do it, but I can't, so I'm not. But they're doing amazing things over there as well. We do have a lot of really cool family events over here, because that's part of the celebration. That's part of the fun about this event, is that your family, your friends, people who may not always have the ability to see what you do on this job get to see what you're doing on this job. So we know we had a lot of families here, a lot of representation from our membership, maybe those not even competing, just cheering on that ALS BLS team from their division, representing them. So it's super cool. It's really cool to see. It's nice to see all these people come out. So it's really, really exciting. But we're going to be back after a short break with the FDNY Fire Commissioner. See you soon.
Last thing I remember, I'm not laying in the bed with the phone like this. She said she just heard the phone fall. I fell off the bed.
He just held his head up, looked at me this way, and he just passed out. He was not breathing, and I knew right then that I needed to perform CPR to get his heart pumping. I directed the kids to call 911, and I also asked them to help me move him because he was not in a position where I could turn him over onto his back to start CPR. I continued, and then the 911 operator said, just keep doing what you're doing. Just keep doing CPR. To the first responders, I am tremendously grateful. I started it, but there was help. Thank God there was help.
She was the first of the first responders. That's why I'm here today. Yep, she... I don't know what to say. I'm so thankful. Without her that night, I wouldn't be here for sure. She gave me a second chance in life.
I was CPR trained about 9 years ago, and when this incident happened, it all came back to me. I remembered everything, every step. I do believe it's important to learn CPR. Every minute counts, every second counts. You never know when you're going to be in the situation where you need to help somebody. You never know when you need to save a loved one.
it's just waiting for the first responders to show up, right? But you've controlled the bleeding, okay?
She's still bleeding. Okay. As tight as possible. Pull it. Push yourself against the wall. Direct pressure. Apply it on the wound.
last thing I remember, I'm not laying in the bed with the phone like this. She said she just heard the phone fall. I fell off the bed.
He just held his head up, looked at me this way, and he just passed out. He was not breathing, and I knew right then that I needed to perform CPR to get his heart pumping. I directed the kids to call 911, and I also asked them to help me move him because he was not in a position where I could turn him over onto his back to start CPR. I continued, and then the 911 operator said, just keep doing what you're doing. Just keep doing CPR. To the first responders, I am tremendously grateful. I started it, but there was help. Thank God there was help.
She was the first of the first responders. That's why I'm here today. Yep, she... I don't know what to say. I'm so thankful. Without her that night, I wouldn't be here for sure. She gave me a second chance in life.
I was CPR trained about 9 years ago, and when this incident happened, it all came back to me. I remembered everything, every step. I do believe it's important to learn CPR. Every minute counts, every second counts. You never know when you're going to be in the situation where you need to help somebody. You never know when you need to save a loved one.
So now it's just waiting for the first responders to show up, right? But you've controlled the bleeding, okay?
She's still bleeding. Okay. As tight as possible. Pull it. Push yourself against the wall. Direct pressure.
Welcome back to Fort Totten. We are here live at the 2026 EMS Week Competition, and my name is Captain Randy Lee, and we are joined by FDNY Fire Commissioner Lillian Bonsier. Welcome.
Happy to be here.
Yeah. So what'd you think of the competition?
Oh my gosh, what a great day.
Fantastic.
Those people are amazing.
Yeah, they're out there, they're putting their skills on the line, and you've seen it from all the past years of this stuff that it's so hard being judged by your peers.
Yeah, I don't think anybody really wants to do that, but these guys do.
Yeah. It's wild stuff, and it gets harder and harder every year.
Yeah.
And I think, and the scenarios are amazing, and with the spirit table, with the families here, it's just amazing, and of course, with you showing up, everyone's happy to see it. So it's
well,
great stuff.
I love being here. This is my most favorite place in the world, right?
Yeah.
And EMS Week, what a great week to showcase all of these skills and all of these high quality EMTs and paramedics, just getting it out there.
So can I ask you, what do you think? What does EMS Week mean for you?
They do so much. They're under so much pressure all the time, and it really is sometimes a very thankless job. And this is the week that we get to put them in the spotlight and really thank them for the incredible work that they do and high quality training that they have.
Yeah.
I mean, they're literally saving lives for a living. So this week is a time that we can do this in a fun way. Right? There's nothing heavy about this. This is all about bringing our families together and showcasing EMS and the great work they do.
For sure. And with all the EMS Week events that a lot of the stations are having, are you going to be visiting those stations and checking out what they're doing to celebrate their members?
Absolutely. I plan on going to get a hot dog and a hamburger from just about everybody.
Well, some people they're going to have ice cream and pizza too. So
I'm a big fan of ice cream and pizza.
That's
so
always good
I'm
stuff.
going to hit as many places as I can to celebrate. I grew up here in EMS, so this is a special time of year for me. I look forward to EMS Week.
Yeah, and it's really exciting to have you back with us as commissioner because, thank you for saying yes to that, of course.
Of course. There's no other answer than yes when you're given this incredible opportunity.
Right.
And, this year's theme is improving outcomes together, so I'm happy to be part of the together part.
Yeah, and it's amazing because with the pin coming out, the poster coming out, all the events coming out, it's such a momentous time for EMS people to really celebrate ourselves and just the work that we do.
Yeah, absolutely. And here in New York City, in the FDNY, we just celebrated our 30th year anniversary of the merger between FDNY and New York City EMS. So it's a special year for us as well.
It is very special. And, soon we're going to have the scores. We're going to see who wins. And this is like the tumultuous time where all the teams are just sitting and waiting. What would you say to any of the teams that are just waiting for their scores?
I would say you're already winners. This is a fun day to play games and to really show off your skill set. But you're competing with the world's best here. So, you're already a winner. You're out there doing the job, and so many people depend on your abilities and your skills. So just enjoy the day.
Fantastic.
If you don't come out number one, you're number one in my book.
Right. Fantastic. Well, I don't want to keep you too long because I know you have to go meet with the other divisions and their spirit tables and all that really cool stuff. And I know the families want to see you. So we are here with FDNY Fire Commissioner Lillian Bonsier live at the EMS 2026 EMS competition. We will see you next year. But stay tuned because we're going to end this stream, but we're going to start streaming for the award ceremony coming up in just a little bit. Stay tuned. Thanks.